right, just waiting for confirmation. All right, we're ready to go. You can start.
Good morning, everybody. Prior to beginning, I think we should all rise and say the Pledge of Allegiance. Senator Crowder, would you lead us in the Pledge of Allegiance? And then please remain standing for another minute, and we will just have a moment of silence for all those that have passed from COVID. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please remain standing for a moment of silence. Thank you. Thank you, everybody. Good morning. I'm State Senator Joe Panaccio, and I'd like to welcome you to the New Jersey Senate Committee on the response to the COVID pandemic. There are those who demand that we prefix our committee with Republican. The reality is that we are a Republican committee, but not because we deliberately chose this venue, but because of the abdication of the legislature's responsibility of administering crucial oversight during this pandemic. From the early onset of this pandemic, Republicans reached out across the aisle to the Democrat majority. In May of 2020, Republican and Democrat leadership agreed to hold bipartisan oversight hearings. Despite countless requests, that committee never happened. The initial agreement was denied. On 3 separate occasions, Republicans sought support from the entire state Senate to create that oversight committee. All 3 times, those requests were denied. May 14th, 2020, denied. July 30th, 2020, denied. August 27th, 2020, denied. Upon the creation of this committee, we reached out to the administration and department officials to participate in our hearings, denied. To share with us through the Oprah process information on formulation and promulgation of the administration's COVID response, denied. Although to be fair about this, we did get a message last night that they still needed more time to tell us what the real death numbers were in nursing homes. And their reasoning was that it would be just a distraction from the staff's attention to the hard work they're doing for the pandemic response. Therefore, any attacks on this committee's efforts as being partisan should also be denied. Moving forward, Republicans still look forward to a bipartisan effort with subpoena powers to help vet what this administration did or did not do as a COVID response. Joining us this morning on the committee will be Senators Corrado, Oroho, O'Scanlan, and Tester, as well as Assemblywoman DeCruz and Assemblyman DeFilippis. They will have brief opening remarks prior to beginning their questioning. Now, we've always heard about how the science and data is driving state public policy with reference to COVID. So I would like to begin with a brief history of the pandemic and the federal and New Jersey guidelines that were applied. First, the COVID virus was first introduced and recognized in Washington state, and everyone saw how it decimated that nursing home. News reports from Europe showed elderly people dying en masse, average age 81. Early on, the CDC, the Center for Disease Control, said, I quote, once introduced into nursing homes, rapid transmission can occur, and, quote, very rapid spread despite an early adoption of infection control measures. The CDC and the CMS, the Center for Medicaid Services, they both oversee nursing homes and they establish operating guidelines. They said, quote, nursing homes should only accept patients they are able to care for. The CDC had two main factors to consider: whether to discharge a hospital COVID patient into a long-term nursing facility. First, was the patient medically ready? Second, could the long-term facility implement recommended infection control procedures? Some of those procedures and those guidelines included appropriate hand hygiene, isolation of infected residents and monitoring of their symptoms, visitor restrictions, use of PPE, identification and screening of staff that worked in multiple offices. And again, the CDC directive was very clear. Nursing homes should only accept COVID patients as long as that facility can follow CDC transmission-based guidelines. Now, what was New Jersey's directive and guidance? New Jersey's directive dated March 31st was identical to New York's directive dated March 25th. Note the CDC guidance was on 3/13, March 13th, 18 days prior. So both New York and New Jersey knew what the guidelines were and what was expected of them. The New Jersey directive said that COVID-infected patients could not be denied admission into nursing homes. The exact verbiage, and I quote, "No patient, resident shall be denied readmission or admission to the post-acute care facility solely based on a confirmed diagnosis of COVID-19. The orders also forbid nursing homes from testing patients prior to admission." The quote from the directive: "Post-acute care facilities are prohibited from requiring a hospitalized patient resident who is determined medically able to be tested for COVID-19 prior to admission or readmission." Also, incredibly, the State Department of Health forbids staff from wearing masks. A NorthJersey.com article speaking of the Paramus Veterans Homes said that they, quote, "devised a series of penalties with the help of Governor Phil Murphy's office against nurses who wore home masks without permission. At the same time, we were told to wear masks in parks and in beaches." Knowing that nursing home residents were at grave risk, state inspectors did not begin making on-site inspections inside facilities, contrary to CDC and CMS guidelines, until April 16th, 36 days after New Jersey reported its first death. The reason, according to Commissioner Persicelli, quote, "the state did not have proper fitting masks for inspectors." That comes from a NorthJersey.com article dated May 21st, 2020. So we are going to get into our witnesses now, but before we call out witness, I just have some housekeeping and some rules, being that we're doing this by Zoom, that I want to make all the witnesses aware. So hopefully please pay attention. We're asking everyone to have their cameras on and microphones muted. If you are not a current panelist, your video will not appear in the meeting. We will try to bring witnesses into the meeting, 1 or 2 people before their turn to testify, so they know they are coming up soon. When you are called on to testify, please state your name and where you are from. For our witnesses who are testifying anonymously, please make sure your name does not display. You may have your camera turned off or pointed away from you. Now, our beginning first witness will be Dr. Stephen Smith. And I'd like to preface this by saying that the focus of this committee will be to vet and offer oversight of this administration's pandemic response during the past year. I believe it is most important, before we begin our discussion, to establish what was the medicine and science behind these discussions. Did we follow proper guidelines? And to that end, our first witness, Dr. Stephen Smith, is an expert in infectious diseases. Now, before we begin, Dr. Smith, thank you for joining us today. Please tell us a little bit about yourself, your professional history and biography, as well as what you think is pertinent that we should know right off the top. Thank you. Well,
thank you, Senator. I thought it was kind of funny when you said, "Where are you from?" I thought, well, Jersey, from here. But anyway, I live in my hometown of Essex Fells. I practice in the same subspecialty of internal medicine, infectious diseases as my father, Leon. My background, I guess I went to high school in Montclair and then went to Duke undergrad, Yale Med School, University of Virginia for residency. And then I was trained under Dr. Fauci at NIH in my infectious diseases fellowship. I moved back here, started working with my dad in '96 or so, and I've been in Jersey since. So my entire practice career has been in New Jersey.
Thank you, Dr. Smith. Let's just get right into the Q&A, if you don't mind.
Please.
Okay, initially, just as a generalization with your background, would you agree that a virus is more communicable in a closed, confined area versus an outdoor setting?
Yes.
Okay. Do you see any difference between a closed, confined setting, such as a prison versus a nursing home?
No, they're often compared.
No, because part of the issue that we had as well, the state of New Jersey was forcing that virus into nursing homes. They were also opening up prisons because they were concerned. Those prisoners are there at the custody and care of the state, and they were concerned that they would also catch COVID in that small confined space. The New Jersey Department of Health guidance is dated March 31st.
Yes.
By March 31st, it was safe to say that the health community should have known the devastation that a virus could have caused in a small confined area such as a nursing home with frail and elderly community.
Yes, that was established by them. Yes.
That's pretty much established science. So the introduction of that virus, the contradiction of opening up prisons and closing nursing homes, do you get a comment on that?
So they were testing for in the prisons, but in nursing homes, they were doing the opposite. Is that what you're saying? Was that the policy?
Yeah, but the CDC, CMS guidelines were pretty clear. Patients that were able, but you had to do certain things. You had to quarantine them. You had to make sure that that you had the PPE. You had to make sure that if you found a patient with COVID.
Yeah, I mean, no, I'm just asking about for the prisons. I'm familiar a little bit with the nursing homes, of course. And just as background for my practice, I'm a prior practitioner. There's another doctor and I, and 4 physician assistant nurse practitioners. Typically, we have 2 at the hospital on any one day. When COVID hit Jersey, about 5-6 days after it hit over in Holy Name, I brought my whole practice into the hospital, not knowing what to expect. We stopped going everywhere else, and we shut down everything very quickly. I saw my first 2 patients on March 18th. By March 29th or 30th, I had seen 70. We all just came in every day for 3 weeks, even though, again, we were just prior practitioners. It was an unbelievable thing to go through. I got a little anxious when you brought up the Seattle data. When the pandemic started in China and then spread to Italy and then to Washington, I read everything I could. And I remember when you brought up the nursing home data from Washington, when the initial data came out, and that was where they initially diagnosed some patients. And that was right before we got hit. And that was not a fun time. But the nursing homes were thrown under the bus. There's no doubt about that. I've talked to a few nursing home, or we call them subacute rehab centers, SARs. There wasn't a lot of guidance. The idea of taking patients back to those places without knowing what to do with them, having resources to isolate them, to protect the nurses, to protect the staff, to protect the other patients. Well, that was just, I don't understand that at any level. That's just infectious diseases 101. We seem to run away from science early on in this pandemic in our response, and I didn't understand that either.
How so, doctor, that we ran away? What exactly did we not, or did we do that was not science-based?
Well, the whole idea of quarantine, right? That's a very old idea, right? The 40 days, I believe it is, it was used for the plague. We've dealt with pandemics before. We dealt with pandemics before we had the germ theory. We know how to deal with them if we listen, to the history, and we isolate. We test and isolate if you have a test, and that just wasn't being done. There was no contact tracing. I had our practice, we probably had almost 200 by mid-May. We had at least 5 people that lived with each other, mostly husband and wife. I remember there was a mother-daughter, or 2 mother-daughter pairs maybe, that got admitted. Well, one got admitted, then the other got admitted. Well, no one went to check on the houses of the people that came in that were positive. We could have done a lot. I didn't see anything really going on in the state level. In fact, it was so anemic, the response. I organized my friends, my neighbors, and their children mostly. And we raised some funds to do some testing. We started our own COVID testing through my nonprofit center. And we just gave free testing, and some of y'all might have gotten tested by us. We did it throughout Jersey. I mean, it wasn't just Essex County, mostly Essex County, but we tested over 7,000 people, and starting in April and through July. And that was really because the state wasn't, and we had lines, and the queue basically ended up being a bunch of 24-year-olds really doing it, and they did a fantastic job. But we raised funds to make sure that it was for free, so we didn't have to bog down things by taking insurance information, and we just got the test done. And I don't know why that the most obvious stuff wasn't being done, and I never understood that.
Dr. Smith, you work in a hospital setting. Could you just tell us the difference between a hospital setting and a nursing home setting, and why nursing homes would not be equipped, even under the best circumstances, to deal with a COVID infection the way a hospital would?
Well, neither was particularly well equipped by mid-March or late March. There were true stories of nursing units running out of PPE and nurses wearing hefty bags. That did happen. But the infrastructure, the support at a hospital is much, much greater. They have infection control teams. They have more infectious disease doctors, a lot more, and there's more space in general. Subacutes, they don't have much at all. And I understand they were pretty limited what any support they got, and the instructions seemed to be against the prevailing ideas of how to stop a spread of infection. Take someone into a SAR, a nursing home, and not be able to test them. That's insane. I don't know what that's about. We worked with the sisters down at Mount St. Dominic and the nursing home there for the retired nun. And we got involved early. That's one of the first places. That is the first place we tested people. And when we had a positive nun, a resident, we isolated her, and we were testing employees to make sure that it wasn't coming and going. But they were doing a good job of testing the residents, putting them into isolation and in coordination with us. And we test the contacts of the employees that got in contact with the patients, and we never had a problem. And that's just infectious diseases 101. It ain't rocket science. And I was stunned by the lack of practical approach towards this.
Dr. Smith, I prefaced my remarks by speaking a little bit about how the administration, both in Trenton and in nursing homes, and veterans homes, they took offense, and they actually were punishing nurses for bringing in and wearing their own masks. Now, is that, first of all, doesn't make no sense to me, but as an infectious disease doctor, does it make any, is there a scientific edict to that? And we know what the CDC and the CMS broad guidelines were. Was that contrary to those guidelines?
When was it? I mean, you remember the mask policy really came out, I think, late May, maybe. But regardless, I don't know why, I don't understand that prohibition. Why would you prevent someone from putting a mask on? We do this all the time. We have respiratory viruses. We have other situations where we wear masks in front of patients. So if a nurse thinks she may be sick or getting sick, or doctor, they'll put a mask on and walk around the hospital. They may not even go in the patient's room with that mask on. But to prohibit the use of a mask, I don't get that. What was the reason for that? I mean, it's senseless. I have no idea why anyone would do that. I just don't get it at all.
We're wondering that also. Dr. Smith, as mentioned before, the Commissioner of Health, Commissioner Persicelli, said that inspectors were not sent in until 36 days after the first COVID death into nursing homes, because speaking of masks, they were concerned that those inspectors didn't have proper fitting masks. It sounds like a contradiction as far as state policy. You either want a mask or you don't want a mask. But if you do have a mask, it's got to be a proper fitting mask.
And that's another contradiction. No, that's not true. For COVID, we've not used the proper fitting one. The proper fitting one, as you all know, or lingo by now, is the N95. That has to be properly fitted. And that's for diseases like tuberculosis, measles, chickenpox, that are truly airborne. This disease is somewhere maybe in between a little bit. But no, the recommendation has never been for N95 masks, not from the CDC, at least, and from University of Washington, UW, where that's where I was reading everything from when I was mentioned earlier. They, from the beginning, because they had the first experience, the first several weeks in the United States, and they're very good at infectious diseases. They said very early on, you do not need N95s to protect the healthcare workers. And they stood by that throughout. And so the recommendation was never for N95s, and that's the only mask you would need to have fitting. The surgical masks, the so-called surgical masks, are what are recommended. And they're just the same size fits all. So I don't know what they were talking about.
Neither do I. Speaking of inspections, how important was it to get those state inspectors into those nursing homes to make sure that those CDC and CMS guidelines were being followed?
I don't know. I mean, I don't know that you're getting into administration of nursing homes there a little bit. I will tell you that the support was needed. I don't even know if they had the resources to enact the guidelines. They were, I think, from what I understand, they were lacking in everything, and early on especially. So to force them to take patients that they couldn't test, that they didn't have the resources to isolate, they couldn't properly protect people, that's just goes against everything I understand about infectious diseases.
Doctor, through your medical circle of people that you know, we had the USS Comfort and the Gavitt Center, as well as other field hospitals. Could we, in your opinion, have better utilized, if not the actual venues, their staff, their PPEs? Would it have made more sense to send a discharged COVID patient to the USS Comfort or to the Gavitt Center, or create a special field hospital, as opposed to putting them in the same population of people in nursing homes, elderly, frail, that had not had COVID yet?
Sure. I mean, I can't speak exactly to the USS Comfort. I've seen it, but it's separation is the key, and obviously that's the very basics of stopping the spread of an infectious disease. Is you take the people that are infected or were infected and remove them from the uninfected pool, and that wasn't done. And there was chances to do that better, and I don't know why it was missed.
Dr. Smith, on May 19th, Governor Murphy reduced the nursing home deaths by a count of 1,400. His quote was, "So that the other 1,400 are no longer in this chart, were not confirmed by lab COVID-19 fatalities."
Yeah, so obviously the testing in the beginning wasn't available. So you could say, well, a lot of people didn't have a positive test because they died before the test results came back, or they never got tested, or in that category. We diagnose people with COVID, as you know, without positive tests. You don't have to have a positive test to meet the CDC criteria for a positive COVID diagnosis. We didn't wait for the PCR, which initially took over 10 days. We hardly waited for that before we started treatment.
Is it a fair assumption, because we spoke a number of times about Washington State and the nursing homes, is it a fair assumption that the medical community knew early on that those people that were dying in mass like that in Washington State and in Europe, that they were dying of COVID?
Yes.
And again, why is it important that we include, we know the actual number of people that died of COVID and where they died, as far as epidemiologically, to be able to prepare treatment, isolation, and to know where we put our resources?
Sure, that's a complicated question. Can you clean that up a little bit for me? You're
enough. I mean, if you take those 1,400 people and you say that they died on the beach, then there's going to be more attention to saying that they caught COVID on the beach.
Oh,
1,400 people into the nursing home environment, that basically screams where our attention should be going, no?
Yes, I guess so. Yeah, I mean, I think the classification of a patient being COVID or not based on a test result I know is wrong. I mean, there were several studies published in the New England Journal where that was not done. People were, these are either prophylaxis studies or treatment studies where the diagnosis of COVID was often made. In some cases of these studies, the majority of times was made without the RT-PCR result. So that is an improper way to diagnose COVID or rule out the diagnosis of COVID in those patients. And obviously, if you have more COVID patients in the nursing homes, you'll focus on them more.
According to CDC guidelines, long-term facilities should separate patients and residents who had COVID. They should look to isolate them, and they should dedicate certain areas within the long-term facilities to their treatment. As mentioned before, part of the edict, after making sure that these COVID patients were not denied admission, also said they could not be tested. Scientifically, how can you isolate a patient? How do you know? Is it telepathically that you know whether that patient has COVID or not? What would be the science behind forcing these nursing homes not to test patients?
There is no science behind it, of course. There's no, that makes no sense. I don't know what the background of that decision was. I can't imagine why they would do it. I really have no explanation for it. It's illogical. It's tough to come up with a reason why. They're trying to limit the resource. Limit the testing to people, other people or something. I don't know. That's very bizarre.
I have one more thing, Doctor, that I'd like you to comment on. You had mentioned, I know I started also about talking about Washington, but in reality, that wasn't the first infectious disease that this administration was subjected to. Back in 2018, I believe, there were actually 11 children that died and 36 became sick at the Wanacue Center for Nursing and Rehabilitation in Haskell, New Jersey. This is what they did, and I'd like your comment on. First, state officials were prohibited from admitting new people into the facility, and requests for readmissions were specifically looked at before they were approved. That makes sense. And even the Commissioner of Health at that time said an ongoing investigation has revealed that not being able to separate the sick from those without symptoms in part is due to the limitations of the facility, is among the major reasons for the outbreak being as severe as it was. So 2 years before COVID, the administration officials knew. They knew you don't put a virulent.
They knew a lot before. They knew long before then. This goes back literally before we had germ theory. Yeah, it goes back to quarantine is in the 1300s, and we didn't have germ theory until the 1870s, 60s. So this goes way back. Yeah, separation of infected from non-infected, leper colonies, of course. So this is as old as it gets. This predates our understanding of human history.
Now, if you weren't an MD, let's say you're making real money on Wall Street, and you applied common sense and reason to some of the things that we discussed, is there anything that was said as far as questioning the state and their response that you would think differently, applying common sense and rhyme and reason?
I'm not sure. Which period are you asking about? In March or?
I'm talking about the whole COVID response. Okay. For us in the middle of this, I compare it to the Battle of Britain, right? Because there was only a group of nurses and some types of doctors and going in, and everybody else was home, and we were out on a limb and left out there on a branch. I mean, it was weird. It was very strange, and it was strange to not, there was a sort of an emotional support, but when you talk about actual support from, there was where they clap or something at 8 o'clock, I forget, or something what people did, but the real support was lacking. The real support from the government was lacking,
And I didn't quite understand it, you know, because this was not exactly like there was some momentum. There was a ramp up time. This wasn't a surprise pandemic. Granted, it wasn't a lot of ramp up time, but there was at least 2 months, 6 weeks, and we weren't prepared at all. I mean, we didn't get any help. I don't think they ever got any really help from the state, you know, or even acknowledgement. You know, they just left us out there. The nurses too. You know, the nurses were very, very brave, and there was really very little support for them. Again, the baggy thing, I don't know if it lasted that long where they used hefty bags for the PPE gowns, but they had to use them, you know, and you know, why? You know, why weren't we prepared for that? I mean, the Washington Post articles were in mid-February. Mike Osborne was already crying, you know, crank up the production of all the masks and the gowns. So it was very strange to be, and you know, who thought New Jersey would be affected, right?
Thank you. Thank you, Dr. Smith. Now, next in line for question is Senator Corrado.
Bye.
Don't go away. We're not done with
I'd just like to make a brief statement, and I really only have 1 or 2 questions for you. I want to thank everyone for being here today. My heart and sympathies go out to the thousands of victims in the state of New Jersey and their families. I hope today is just the first step in getting answers and accountability from Governor Murphy and his administration. And I would urge my Democratic colleagues to join us in the quest for transparency. And I'm looking forward to, in the near future, having independent bipartisan hearings with subpoena power to get more answers as we proceed. But Doctor, I just want to touch briefly on, you had mentioned that you as a doctor were aware of the Wanacue facility, and there were protocols. There was actually a report written from the Department of Health on how to handle similar situations. Do you know if those protocols were ever implemented in the state of New Jersey?
For COVID?
For COVID, for subacute facilities, on how going forward, infectious disease situations should be handled?
I don't think so. You know, I'm not intimately involved with the administration part of subacutes. I have had several meetings over the years with them, with the leaders at the different subacute rehab centers in the area. But I don't think they were ever implemented. I don't know for sure.
Okay, would you be surprised to know that there was actually bipartisan legislation passed and signed by Governor Murphy, and the Department of Health pushed back on it and didn't want the oversight for making sure the protocols were implemented, and instead put most of the facilities throughout the state of New Jersey on the honor system?
Why? Legislation?
There was legislation on implementing, you know, protocol after
the public health. I see. You pushback. That makes no sense. Yeah, I mean, you develop these guidelines and these protocols for a reason. So I'm not sure why they would not want to oversee that.
And we know that many of the healthcare workers were absolutely the heroes during this pandemic in the past and continue to be. So were you surprised when Senator Panaccio mentioned that the state of New Jersey, more specifically the administration, along with management at the 3 veteran nursing homes, came up with a penalty scale for staff that wore their own PPE to the facility?
It's so that action's so scary. I just thought, what is it about, and why can't you wear a mask? You know, what if you had a rash or something you'd want someone to see?
Right. I mean,
I don't think at any level.
You certainly mentioned that there was protocols, you know, for certain illnesses that staff was required to wear a mask and gloves in the past.
Of course, that's where you guys started about PPE and masks, you know, this past March, but you know, we've been using those protective gear for a long time. They're used for other respiratory viruses. They're used for the flu. So we did the same protocols for flu as we did for COVID. So I mean, if the patient had flu, were you allowed to wear the mask when you were in the room? I don't, because that's the standard. So why would they do that? What were they worried about? The patient's feelings if the nurse was wearing a mask?
We don't know, and we wish they were here to answer those questions today. It's so important that they do answer them, but I do thank you for your time and for being here.
Sure.
Next up is Senator Aho.
Thank you, Senator Panaccio, and I want to thank everybody also for who's going to be testifying. And I do see Jennifer Jean Miller is going to be giving some comments next. And I just thank everybody for doing this. And Dr. Smith, thank you very much. I obviously want to associate myself with the comments that Senator Panaccio and Senator Crowder have already made. And I'm sure we all feel exactly the same way. Now, Doctor, we mentioned the PPE, and I know back in March and April, everybody was scrambling around, and you mentioned the idea of on the pandemics that there needed to be segregation, isolation for those who were infected, and it's just that obviously it wouldn't spread. But as I did a lot of reading and whatnot, I certainly I'm a finance guy. I have no kind of experience that you have. But as I recall, when polio was rampant, was
how old are you? You don't look that old.
No. The reading. But I thought one of the things that they did is they used isolation. They had specifically identified units. I understand other states did the same thing. I think I know the answer, but I think that would have helped lower the spread, particularly within the nursing homes and any other facilities. Correct?
Yeah, actually, the CMS guidelines, or CMS, CDC, I believe, guidelines for COVID were suggesting that if you can, carve out a wing for your COVID patients. These places have limited resources, right? So it's very tough for them to move patients around and to corral patients. And if you can't test them, then of course you can't identify them, so then you can't corral them. There was also a changing shift on what was the meaning of a positive test result, and that is still sort of unanswered. But the CDC was changing their definitions of the meaning of the positive test result. So it was a very confusing time, and they could certainly the subacute rehab centers could have used a lot more hands-on guidance. And the fact that they needed fitted masks for their staff to go in. I mean, yeah, that's sort of the support I'm talking about. I mean, these people I know these people. They work hard, and they were left out there. And then you say, now for over 30 days, the state employees are waiting, for fitted masks. Well, they don't have any masks, and they weren't allowed to wear masks before that. And the fitted masks were never, ever, and still are not, recommended. So it's a bizarre response. That's what I mean by leaving us out in a limb. I mean, you don't get any more left out in a limb than that. But yes, segregation is that's what we've been doing for millennia, with infectious diseases, and they just didn't allow it. They just didn't give them support to achieve that. You could imagine within a system that you send all your, there are certain SARs that have more than one facility. You can imagine that, well, this is the COVID facility, and over there we have the non-COVID facility. And that segregation could have done a lot of good, because starting at about the first, second week of April, most of our admissions came from nursing homes. We knew that. And to their credit, they ramped up the isolation, the PPE, the testing, and I don't know if they ignored the state guidelines or what, but they by mid-May they had control of it, which was that's a testament to how hard they worked at it, because it was out of control for all of April, but they got under control by early May.
Well, Doctor, thank you very much. And my mom had worked in nursing homes for many years as a nurse, and I know the healthcare personnel. I'm sure every time that somebody would, for whatever reason, pass away, it was almost like a family member, passing away to them. And I feel so sorry that they weren't given the equipment that they needed. We didn't have the isolation that we needed. But I want to thank you very much for for coming here today, and thank you.
Yeah.
General Scanlon.
Thanks, Senator Panaccio, and thank you for chairing this committee. For my colleagues for participating. Thank you, Doctor, for being here, and everybody else who's watching. I got a couple of quick comments, and then really just one of my questions hasn't been asked already, so I'll ask that when I get to it. One of the most troubling things about this whole debacle is the lack of care and concern by our colleagues. Senator Panaccio mentioned it, but it's outrageous that not one Democrat in either house decided that this was an important enough topic to be here and to participate. Back in the spring, Republicans started our quest for a bipartisan committee with subpoena power, and everybody's on board. Leaders on the Democrat side called it a moral obligation to have hearings. There were newspaper articles all summer about their failure to act, and yet here we are in March, and apparently nobody gives a damn about this loss of life. That is shameful, and it should be said. They were invited, as Senator Panaccio mentioned, to be here today. It's striking that not one of them decided to participate. We have a smoking gun that demonstrates that this administration dropped the ball dramatically. Doctor, you mentioned it. Joe, you mentioned it as well, Senator Panaccio. There was an American Healthcare Association release of March 29th that warned against, in absolute terms, what New York had done a few days earlier, that forced COVID positive patients into these facilities where it was obvious they were going to kill people. Yet, and with the benefit of that, the New Jersey Department of Health still copied New York's directive word for word, and on the 31st made the same mistake. Why was no one paying attention? It is illustrative that back in the spring of 19, the Department of Health began systemically tearing apart the human resource fabric of our Department of Health emergency preparedness infrastructure. That's a story for another day, but it's one that should not go ignored. It's also troubling that the Murphy administration has shown no interest themselves in figuring out where mistakes were made, admitting that, and making sure that we take corrective action, making sure that we communicate to the loved ones of those who needlessly perished, that somebody gives a damn. We've been doing it right along. We're doing it again here today, but that the Murphy administration not only is not going out of their way to find out what happened and share it, but is hiding behind a bogus bandwidth claim that they just don't have the resources, and also in an abuse of the Emergency Health Powers Act, which the legislature should take action to correct. Somehow, though, other states have managed to care about these issues and deliberatively go at investigating and figuring out what went wrong and ensuring it doesn't happen again. Massachusetts did a great job, praised by the press, praised by people on both sides of the aisle. The New York Attorney General found the time to take some action. Instead, the Murphy administration actively circles the wagons. Hey, we got a 60% approval rating. Nobody will give a damn about those people that needlessly died. It's shameful. And they still then, in the same breath, claim to be transparent. The Murphy administration is to transparency what a block of cement is to a ray of sunshine. Thank goodness we don't need the Murphy administration's cooperation to amass overwhelming evidence of the mistakes that were made. Doctor, you've hit on it repeatedly this morning, over and over again. We have whistleblowers from within the Murphy administration's own Department of Health that have come forward to help us. We have quotes from them. We have newspaper reporters who have verified their substance. And that leads me to simply say, hopefully this inquiry that begins here today formally won't die. Hopefully this line of questioning will be joined by some Democrats with spines in the legislature who grow them after today. It would be nice if that happened because the people that perished and members of their families that we're going to hear from today shouldn't be ignored. Shameful. So doctors, one real quick question. I mentioned that smoking gun that we have, the American Healthcare Association. That's a substantial and trustworthy entity, is it not?
Yes.
Okay, you're familiar with them. When they made their announcement on the 29th, it was news. I heard about it on the 29th or the 30th. So did you, I'm assuming.
I don't know, 29th of March. No, I was a little busy.
I understand. But it was out there. And it strikes me then as completely outrageous that New Jersey still on the 31st copied New York's directive. When you look at that chain of events and the knowledge that we should have had going into making that decision to release that directive, does that not outrage you?
There's a lot about how this pandemic was handled or not handled outrages me. And that's part of it. You know, I guess the move was done to make some room in the hospitals, but the way they did it absolutely made no sense. But the science was secondary in the handling of the pandemic by lots of facets of our government. And that's something I'll never understand. I'll never get my head around. I was an AIDS doctor, you know, I still have our HIV clinic that's the nonprofit I was referring to. And back then, when I came up, I basically cut my teeth as an AIDS doctor. And in that situation, that epidemic, you know, the Republicans were quote unquote the bad guys, right? They were against this, that, or the other thing. They were never ever against treatments or logic. They had differences on social issues, on whether to use condoms or not, you know, things like that. But they never were celebrating drug trials not working, commenting on drug trials. I never saw this coming in my life. Again, you know, I'm nonpartisan. You know, again, I'm just a physician, and to be someone who's spent so much time in the inner city and working in AIDS, to see this happen, I have no idea why it happened.
And that's part of the tragedy. And I really appreciate your time today. Virtually all my other questions were asked and answered. So thank you, Senator Panaccio, for permitting me this time to speak.
Thank you, Senator. Senator Testa?
Thank you, Senator Panaccio, and thank you for all of the attendees, and thank you for all of those who are watching. And thank you, Doctor. For nearly 1 year, we've watched Governor Murphy rule under executive orders that have placed unnecessary harm on our residents in long-term care facilities and our veterans' homes. I've said it from early on during the pandemic that the Murphy administration has blood on their hands. On May 11th of last year, I demanded that the New Jersey Department of Health take responsibility for the then nearly 5,000 COVID-19 nursing home deaths. It also should be noted that Senator Panaccio, who's called this committee together, called for a select committee last year on April 16th of 2020. Here we are in March of 2021, and while this issue should be a nonpartisan issue, I'm sure it will be painted as a partisan issue. And the facts are what they are, that an entire side of our legislature has refused to participate. Residents across New Jersey deserve to have their voices heard about their firsthand accounts on the Murphy administration's failures to protect our elderly and our nation's heroes. It should be known that Commissioner Persicelli and the DMAVA commissioner were invited but declined to attend. They were unwilling to answer questions from legislators or face family members in a public forum. Shame on them. And Trenton Democrats have stonewalled every effort of ours and are willing to protect Governor Murphy. However, we can no longer wait to hear the truth. The Murphy administration, quite simply, has not been transparent at all during the COVID-19 era. New Jersey Democrats have been unwilling to limit Governor Murphy's executive powers or review their use. And the Murphy administration is hiding fecklessly behind their Oprah exemptions, not allowing residents, the press, and even legislators the ability to transparently review the governor's policies. Doctor, are you aware that the New Jersey Department of Health and the New Jersey Department of Corrections decision to move COVID-19 positive inmates from North Jersey prisons into South Jersey facilities?
No. So they're corralling them? Putting them in one facility, all the positives, or what were they doing?
That's correct. Instead of putting them all in one facility, there were COVID positive patients transported from North Jersey facilities into South Jersey facilities.
Into facilities that had non-COVID patients, I mean, patients without, or had inmates without COVID?
That's correct.
That's not a good idea.
No, it is not. So taking that as fact, and I can represent to you that that is in fact true, that is what happened. And I can tell you this is very personal to me because I represent a district that has the largest amount of prisons in the state of New Jersey and the largest amount of inmates. Taking that as true, do you think that is a good idea?
No. No, previously stated, obviously corralling, I thought you were telling me that they took the positives and put them all in one facility, or they removed them to a few facilities. That makes sense. Doing the opposite makes no sense.
Well, I can tell you that did in fact happen. And also, I can also represent to you as true that while visitation was prohibited into our long-term care facilities, preventing family members from seeing their loved ones on their last days, they were still allowing in-person inmate visits in the New Jersey Department of Corrections. Do you think that is a good idea?
No. I mean, the visiting thing was always a problem. I don't know that it helped anybody in the hospital. It certainly hurt the patients, it hurt the morale. I think things got a little slacker because there was less people around, to say the truth. But that certainly doesn't, it's incongruous. Why would you let one population have visitors, not the other? So I agree that you should be consistent in the policy.
And you stated that separation is key earlier on in your testimony. Do you believe that the New Jersey Department of Corrections should have tested, quarantined, and separated positive COVID-19 inmates before transporting them into an already allegedly crowded South Jersey prison and created a South Jersey outbreak?
Oh, yeah, of course. Yeah, absolutely. I mean, yeah. I mean, they could have done it the easiest, and I guess obviously they didn't. They could have corralled their positive COVID patients into one facility very easily, or several, a few facilities. I don't know how many inmates were COVID positive, but they have the ability to corral, and they chose not to, I guess. That's what you're telling me, and that was a mistake.
Earlier on in your testimony, you stated that you were stunned by the lack of a practical approach.
Yeah, there was. We didn't see anything coming. In January, you start to perk up, right? We start hearing, and then the travel ban from China. That's when I paid attention. There was no travel ban when Ebola came out, right? None. The travel ban was you had to fly into certain airports. When I heard there was a travel ban from China for non-citizens, I was like, oh. And then all of a sudden it just hit. But we had about 6 weeks between that, and there was nothing. And then there was nothing for the next 2-3 weeks. We saw nothing from the state. And then you had the policies that were up and down and didn't make sense. And and then it just, I don't know what they were doing, to tell you the truth. I just didn't see any action. When they contact tracing is you're all familiar with these terms now too. It's easier to talk, as you know, our vernacular. That's part of what we did, right? And we didn't do that. And the contact tracing that eventually took place was like phone calls or something. I don't know. But if we'd done contact tracing in the beginning, we could have, really regrouped those people, crowd those people, or at least isolated those people, and reduce spread. So if we tested and isolated, test and isolate repeatedly, then we could have really had a big impact on this pandemic. But we did the opposite. I don't know what was going on.
And
I wasn't involved.
I'm trying to keep this as absolutely nonpartisan as possible, obviously. And that's how I believe these hearings should remain. But you stated that you saw nothing from the state. And I'm sure that the response is going to be that this was much more of a federal issue than a state issue. Do you believe that there could have been a much better response from the state of New Jersey?
So by early April, mid-April, my wife and I organized this team of neighbors and their kids to do testing. And, you know, why are we doing that? And I was doing it because no one else was. And, you know, there wasn't widespread availability of testing. So that's how you get to control things. You find out who's positive and you get them isolated. And there was a real lag behind that. That should have been, I shouldn't have been us doing that. I didn't need more headaches, to tell you this, you know. But my friends were all home, they weren't working, they're asking how could they help. And so they helped me raise money, and then their kids did the swabbing, for the swab mom. And that wasn't something, you know, we were looking to do. It was something I knew should be done, could be done, and would help. And that should have been done by the state right away. And I never saw that until much later. You know, the state just wasn't involved in testing it. And I don't know why. No clue why.
You stated that it's now become part of our vernacular, the term contact tracing, and it certainly has. And look, I'm an attorney and a legislator by trade. I don't play a doctor on TV. I don't pretend to be a doctor. So I'm asking you this with full sincerity here. Isn't it true that contact tracing, in order to be most effective, needs to be done early on?
Well, I'm not sure what you mean by early on, but so contact tracing is a broad term. It's not just for respiratory viruses or COVID. Contact tracing for HIV, for instance. But any contact tracing is better than none, right? But when you have the person diagnosed in the hospital, it was a very reactive. There was nothing proactive. Let's use that term. It was reactive, and it wasn't even reactive in a community way. It was just reactive that we're going to treat these patients or send them back home when they got to the ER. There was no outreach. There was no one saying, okay, well, we need to, those people came from somewhere, and the people that they're living with are obviously very high risk. Let's find them. And that wasn't done, you know, and I have no idea why. And yeah, obviously the earlier you do anything in infectious diseases, the better. But it just, I mean, forget early, nothing was done, not in those months. I didn't see anybody saying, okay, well, we need to go chase down the relatives of patient X. You know, never happened. Not in the March and April. And it's not brain science. I mean, it's not brain surgery was the term. But it's crucial. And we were going to, when we started doing the testing, I was toying with the idea of, do we have enough resources, and can I send my team into the houses of these people, the patients, and there's an intrusion there, and there's HIPAA issues too. But I was toying with doing it myself, just because it should have been done and wasn't being done. Unfortunately, in the early mid-May, the rate of new cases dropped down a lot, so we didn't need to do it then. But it should have been done right away. It should have been set up right away. It was weird to see something so obvious not being done, and then these weird things about you can't wear a mask. The whole thing was insane, and I'll never get over it. I'll never understand it.
Doctor, this is my final question. Had a practical approach and a scientific approach been taken to the handling of COVID-19, could New Jersey have avoided shutting down its economy entirely?
I assume so. I'm not an economist, but and I don't know exactly when they shut it down, but I thought we didn't do the things you're supposed to do. You're supposed to find out who's at risk. We didn't do that. We didn't prioritize any of that. So early on, the first risk we all talked about was age. In the first 3 or 4 days, I'm seeing patients, they're breaking all the rules. They're young, they're obese, they're diabetic. You're not supposed to be that with viruses. And this is not published. So my team, actually Ken Lau is a nurse to the ICU. I go, Ken, what the blank? And Ken's been there for 20 years. And Ken goes, I've never seen so many really obese people in the ICU. And that's true. We don't see that. So all of a sudden we have a newly identified risk group. That never happened with this obesity and diabetes connection. That doesn't happen with viruses. There's obesity with flu a little bit, but not diabetes. And they were all diabetic. And so we had this risk group that we knew about, and people just looked the other way. So if we identified the risk groups, if we used contact tracing, we protected the highly at risk patients, the whole thing would have been different. And it's just the most obvious thing in the world, and then we didn't do anything. So I guess you hit a nerve.
Thank you. That's all I have.
Thank you, Senator Tester. Assemblywoman DeCross.
Thank you. Thank you, Mr. Chairman. Thank you for holding this today. I thank all my colleagues for being here. And I thank everybody that's listening to the testimony, and sad that, you know, we do not have our colleagues from the other side of the aisle with us. A lot has been talked about already and said, but one thing I would like to just go back a little bit on is what Senator Carrata was talking about, and that was the Wanacue outbreak. That outbreak took place in 2018, the virus outbreak did. And at that time, the state of New Jersey reacted as they should have, and the legislature properly put into place rules and regulations for them to follow. Obviously, the administration felt that they did not need to make the Department of Health obey and follow the rules and regulations. Everything's about rules and regulations. If we take a look at Homeland Security, we know that Homeland Security follows the policies and procedures after attacks that have taken place in our country. So when the virus hit in 2018, the policy and procedures should have been put into place, and they should have acted on them so that there was a uniform approach on the pandemic. That did not happen, and it's obviously has not continued to, you know, be one set plan going forward. I mean, we constantly hear every day at 1 o'clock the governor's statements and numbers of how many cases, how many deaths, where we are. We constantly hear him talking about working with his colleagues in other states like Governor Cuomo, which should be very concerning to all of us if that's who he was listening to based on what's going on in New York. So there's a lot here that could have been done, could have been prevented. And I think as we go through this testimony and we start listening to everybody and my colleagues sitting here with us today, we're going to get more to the truth than not. So, Doctor, I just have one question that I'm going to ask you. Nursing homes were required in April of last year to accept COVID positive residents. Although the directive was ultimately rescinded, what do you believe was the impact of the directive by doing that?
Well, I mean, I wasn't in nursing homes. We actually pulled out of the SARs. We go to SARs regularly, but we were out of them. But the only thing I can imagine it doing was increasing the chances of spreading the virus. To force that situation, you want to do the opposite, of course. You want to make sure that they can handle and separate patients first with the virus rather than just force them to take them back. You know, forcing them, any facility to take on a group of patients they're not ready for is bad policy.
So what if there was policies and procedures, I would have thought that probably wouldn't have taken place if it was implemented properly as the legislature had tried to do. So, you know, I know you weren't there, but common sense prevails. And I think we all have common sense, and we know that you don't blend sick people with well people because people are going to get sick. So,
and I mean, I know they were on their own. They stopped looking to the state really quickly. If anything, they wwere trying to fight against the state's policies. And, you know, they did a good job eventually, but
yes, they did.
It was a tough month.
It was, and I do recall one incident early on in March where the Woodbridge facility, everybody was sick in it. And I received a phone call here at my home saying that about 80 patients were being transported to Care One in Whippany, which made absolutely no sense to me as to why they were doing it and why they didn't keep everybody confined in the facility they were in and just brought more help in to help control it. So I thank you today. I think we'll find out more as we talk and discuss. And I think we're serving the people right by holding these hearings. So thank you.
Welcome.
Thank you, Assemblywoman, and thank you, Dr. Smith. Now, as we go forward, there was a reason that we gave a lot of levity to Dr. Smith and his testimony.
I haven't had a chance to question the doctor yet.
I'm sorry, Assemblyman, forgive me. You're up
Taking the
next.
best for
Thank
last.
you.
Let me just
I'm
make a
sorry.
quick comment, Senator. Thank you. The legislature is a co-equal branch of government with the executive branch. We need to know how many people actually perished in our nursing homes after the Commissioner of Health gave the green light for COVID positive patients to return to long-term care facilities. How will we ever know the actual death numbers we have been given are accurate and credible until the Commissioner of Health actually testifies before the legislature under oath? We have every right as legislators to ask these questions, and we have every right to demand that DOH witnesses come before us to answer for what actually happened in our nursing homes. So that is my comment. And Doctor, I do have a few questions for you. Thank you for being here today. We really appreciate it. Sir, what data have you seen, if any, on the number of New Jersey residents who perished in nursing homes after the Commissioner's directive?
I don't remember the numbers I've seen. I remember seeing the 5,000 number, but I don't really remember.
So you say 5,000?
I believe I saw that number, but I didn't follow those deaths separately.
Okay. I mean, we're talking about 8,000. At least that's what we've been told. Are you aware of that?
I don't know. No, I'm not. I don't, again, like I said, I don't follow separately the deaths in the nursing homes. Okay.
Do you have a personal belief or opinion as to the number of people who died in nursing homes after the Commissioner issued her directive?
I have no idea.
Okay. Do you know how the Department of Health defined a COVID-related death in the nursing home context?
No.
Do you know if the Department of Health ever counted nursing home deaths as hospital deaths if the victim from a nursing home actually expired in a hospital?
I think that, yeah, I remember reading that. That I remember, but I think it was New Jersey where I know I've seen New York, they did. But if they died in the hospital, that was counted as non-nursing home death. That's my memory. But
yeah, it's my understanding in New York that some nursing home deaths were counted as hospital deaths because the person actually expired at the very end in a hospital.
Right.
Are you aware of that happening in New Jersey, that type of counting?
I don't know. I'm not familiar with the counting. So I don't know. Sorry.
Okay. Do you have any belief or opinion that, like in New York, New Jersey somehow undercounted nursing home deaths?
I don't.
Okay. All right. I appreciate your time. Thank you, sir.
Sure.
Thank you, Assemblyman. Thank you, Dr. Smith. Now, we spent an inordinate of time talking to Dr. Smith, and that was by design. Future witnesses will not go on as short. I would ask the members of the committee, if they have a pertinent question, to just raise your hand. That way we know that you do have a question that you would like to ask of any future witnesses. And again, to me, it was important that this committee is grounded in science and in medicine. So that's why we spent, and we gave an awful lot of time and weighted the testimony of Dr. Smith, because all decisions as far as the pandemic and the state's response should have been grounded in science and medicine. So thank you, Dr. Smith, very, very much. And thank you all my colleagues for some of those very interesting and pertinent questions. Okay, next up is Jennifer Jean Miller. Jennifer was a former New Jersey Herald reporter, and Jennifer also broke the story about the Andover nursing homes. Welcome, Jennifer, and if you have any remarks, please share those with us.
Yes, I'm going to read the statement that I prepared, if that's okay.
Sure.
Well, good morning. My name is Jennifer Jean Miller, and on March 27, 2020, my life's course changed entirely when, as a New Jersey Herald reporter, a brave whistleblower employee from Andover Subacute 2 contacted me, alleging the facility had planned to set up a COVID wing for patients overflowing from local medical centers, that they would be terminated if they didn't work in this wing, and they were told they must buy their own PPE. This was the start of a series of whistleblower calls from employees, family members of residents, and even residents who contacted me in tears and didn't know where to turn. They looked to New Jersey's Department of Health for answers, and said their cries for help were ignored. The same happened to me when I next called the state ombudsman's office the same day that I received that first phone call and was punted to the Department of Health. I would later learn the ombudsman was allegedly barred during lockdowns from visiting facilities that they had received complaints about. I had no previous problem in the past.
Jennifer, a second. Could everybody, or if you're not talking, please mute your phone because you're getting some background static and it's difficult to hear the witness talking. Thank you. Go ahead, Jen.
And my apologies, my dog is starting up in the middle of this, of course. Let me mute my microphone one moment. I apologize.
Okay. Welcome to a virtual meeting.
Sometimes kids are worse.
All right. Oh, as I was saying, I had no previous problem in the past obtaining information from the Department of Health, including in 2019, when a dementia resident at Andover Subacute 2 escaped the facility and one night into below freezing temperatures. However, COVID further opened my eyes about the Murphy administration optics, which includes the use of deflective gaslighting techniques to keep the spotlight off of its own wrongdoing, which returned me to November 2018, when I filed an Open Public Records Act request for Governor Murphy's correspondence and Department of Transportation documents after he declined to declare a state of emergency, leaving thousands of commuters stranded for up to 12 hours on New Jersey's roadways. My request to his office was denied, they claimed because it was overly broad, contained deliberative material, and could not be released because of executive privilege. The DOT stalled on my request for almost 2 months and finally advised me due to my request scope and document redactions, my request would be a significant dollar amount to fulfill. In other words, the Murphy administration is obstructive when its own reputation is at stake. Getting back to the pandemic situation in March and in April 2020, 2 whistleblowers tipped me off on April 14th about 17 bodies in a makeshift morgue in Subacute 2, a story that broke on April 15th, 2020, which received media attention internationally and more whistleblowers stepping forward. In a tragic twist of fate, I was informed on April 24th, 2020, that my last day of work at the paper would be May 1, 2020, as part of a company-wide layoff during the pandemic. I promised the whistleblowers I would continue to seek answers however I could, which is why I'm here today. I'd like to read to you a statement from a Star Ledger article. And by chance, this lovely woman pictured, Betty Jane Jaeger, is someone I happened to know. I learned as my investigation was underway that she had been at and died a horrific death at Andover Subacute 1. I received many whistleblower calls from staff, family, and even a resident about the care in this facility. Yet, unlike its sibling facility, Subacute 2, it strangely came up with a clean inspection report after the state intervened following the story about the bodies on April 15th. Governor Phil Murphy, his administration, and nursing home owners have jousted over who's to blame for the thousands of deaths and horror stories. The operators say the state left them vulnerable and without the tools they needed. Murphy called the home's response to the pandemic uneven, disappointing, lacking in communication, lacking in basic blocking and tackling. And forgive me, she's barking again. Governor Murphy's statement in that article could easily apply to his own administration's conduct. He deflects blame from his own administration to the long-term care. It's the state, however, that licenses these facilities. And while the facilities were at fault in many ways, it was also the Murphy administration which followed the state of New York into the rabbit hole of grossly misinterpreting CMS and CDC directives for long-term care facilities. Those directives indicated if facilities could not properly separate the ill from the healthy, the COVID positive should not be brought into those vulnerable facilities. Governors Phil Murphy and Andrew Cuomo also both had the USNS Comfort available to care for COVID positive. They declined to use it and sent it away at the end of April, just after nursing home deaths peaked. The hospital ship only taking in 182 patients within the 1,000 bed hospital ship during its 30-day stay in the area. I'm going to show you all a routine inspection report from the Andover Subacute 2 facility dated March 5th, 2020, ironically, 1 year ago today, and which comes from New Jersey's Department of Health's own website. This report, however, was unavailable to the public and to me during my investigation in March and April of 2020 because of the clamps that the Murphy administration placed on the Open Public Records Act, which has made it difficult for reporters and even entities such as the County of Sussex to obtain information from New Jersey's Department of Health. However, this report became available online when I was interviewed for a Nightline segment in June 2020, and I shared it during my interview. The Department of Health has continued this practice of not being timely in placing nursing home inspection reports on its website. For reporters watching this broadcast, the Andover subacute facilities have since rebranded according to the Department of Health's database, with Subacute 1 renamed Limecrest Subacute and Rehabilitation, and Subacute 2 now called Woodland Behavioral and Nursing Center. So here we were, just days away from President Donald Trump declaring a national emergency, but this report retells on page 10 that the inspection surveyor found on March 4th, 2020, this facility was out of compliance with New Jersey Administrative Code because it did not provide proper tracking of a resident's death. During the pandemic, one of my staff whistleblowers told me during my investigation that the person who tracked deaths at Subacute 2 was out ill and deaths were not being relayed properly to the state. Again, the state knew of this vulnerability with this facility on March 4th before the national emergency. On pages 13 and 14 of this same report, it discusses the lack of documentation on residents' charts, something family whistleblowers told me during the pandemic, their deceased loved ones' charts not being properly updated either. The surveyor documented this problem on the March 5th, 2020 survey 1 year ago today, again known to the state before the national emergency. On pages 22 through 33 of this report, infection control was a major issue, the surveyor noted, with several instances during their routine inspections that there was a vulnerability at this facility with sanitation and infection control, the facility out of compliance with New Jersey Administrative Code on hand hygiene and glove wearing among its infection control problems, which the state was aware of before the national emergency was declared. I believe New Jersey's Department of Health purposely dodged me and those battling problems with the care of their loved ones in nursing homes during the pandemic. After my first call on March 27th, my requests were ignored until, thanks to the help of Legislative District 24, I was able to connect with another Department of Health representative, and that representative did what they could as well to brush me off. For one of Governor Murphy's senior staff members, 24 also recommended I contact the governor's staff member, never responding to the reporter who emailed them the same day the story broke about 17 bodies found in a makeshift home. The question I ask is why? Why, when I carried such important information, as well as families who cried out for help, were we ignored by the Department of Health and the governor's office? We need to get to the bottom of what went wrong in New Jersey's nursing homes, which according to this CMS report shows 124.3 of 1,000 nursing home residents have died. This number is the highest nationwide and more than double New York's death toll, which is down here at 55 per 1,000. And of course, New York is a state now under investigation for its own nursing home deaths. I pray for all of you that you can cut through all of this red tape, and I thank you all very much for having me here today.
Your testimony. Senator Arho?
Yes, Senator Panaccio, Chairman, thank you very much. And Jennifer, thank you very much, because you and I have had many conversations, and I just want to mention one thing. I know that governor's executive order went out on March 31st that the nursing homes would have to take the infected individuals back. And here's something that was actually sent on March 27th from myself directly into the governor's office. And obviously it had a lot to do with what Jennifer was hearing. And she was, we were in contact. Obviously, I was also in contact with the Office of Emergency Management. But here's something we had said was we have a situation here. And remember, this is March 27th. March 27th. So a matter of days before the executive order came out. We have a situation here in Sussex County which is causing a massive uproar. We all know nursing home patients are currently under isolation with no visitors allowed, not even immediate family members for fear of COVID-19 transmission. It seems preposterous that a nursing home would be allowed to bring infected people into the most vulnerable population. That was actually, and we did, the response was thank you for bringing it and flagging this for our attention. I bring that up because that was obviously days before the executive order went out, making sure that individuals were put back into the nursing homes and infecting other areas. And Jennifer, I have no specific questions because your testimony was terrific. I do know the one thing, the issue of the information that you asked for and should have been available. And I do know the amount of effort that you went through in order to stay in and asking for this information. One, because the people expected this of you, and you told them that you were going to do it, and on your own time, you continued. So first of all, I want to thank you very much, and to all the families that you have been representing. You've been a rock for them, and thank you very much. And I know you already mentioned about how you could not get the information, even though it was obviously something that was open public record material, and you were stonewalled in almost every single attempt to get it, correct?
Yes. It was very hard to get information from the Department of Health, and technically when I was told on March the 27th, after the Ombudsman office had asked me to contact the Department of Health, I did get a representative over the phone, and the representative that I had worked with in 2019 was a wonderful woman who was no longer there. So I was directed to a person over the phone, and that woman asked me to send a request in writing, which that should have started the Oprah clock ticking under normal circumstances. One of the obstructions when I finally did reach somebody at the Department of Health after contacting your office, which was really, I was able to finally reach somebody after the story about the bodies came out on April the 15th. So it was around April the 17th that I believe they told me, and they tried to tell me, that I had to submit an Oprah request by a special system, which I corrected them. And I said, absolutely not. I said, in email counts, I said, let alone if I didn't have email, I would be allowed to send this to you, certified return receipt in the mail, and that would have started the clock. So I warned them, you're on the clock already. And we went back and forth. And I can tell you that the County of Sussex, because I'm actually a consultant at this stage since I was laid off from my position at the Herald, that they have Oprah requests from last year that haven't been answered. And, you know, they've gone through the same runaround with this and almost worse with what has been done. They're a government entity, and basically they haven't been properly answered.
Yeah, and unfortunately, actually, the originally that came out from the state was that they were blaming the County of Sussex, and it was completely opposite way around. As you talk about the deflection. And to my colleagues, I will just end with this. And Jennifer, thank you so much. And I know you're continuing on your efforts. But the email that I'm talking about, the reason why we sent it was because we were hearing from some of the people inside of the nursing homes that some nursing homes might have been taking for business planning purposes infected patients, and obviously the personnel was concerned that how could a nursing home be doing this? I don't know if that was something that was actually occurring, or was that happening because the nursing homes were now getting communications from the administration or the Department of Health that to start getting ready for this executive order. So one of the things that we should obviously be looking at is any kind of communications going between what the nursing homes and veterans facilities were forced to do, but based upon executive order, and those communications that occurred. Because obviously this email I have back on March 27th, they were concerned inside the facility that maybe the facilities were doing this for business plan purposes, or it could have been that they were already being communicated that this was going to be coming in the next couple of days. Because remember, Governor Cuomo had already issued his executive order. So Jennifer, thank you very much. And thank you to all the rest of the witnesses. Appreciate it.
Thank you, Senator. Senator Corrado?
Thank you, Ms. Miller, for sharing your story. I can hear the pain in your voice, and I can also hear the frustration. And we share that frustration. It was important for these hearings to be bipartisan. It was important for our Democratic colleagues to be here so that we had the subpoena power to force the Commissioner of the Department of Health and DMABA to be here and answer these questions. So until they're willing to do that, we're not going to get the answers that we're entitled to. And I'll remind them that there's over 8,000 reasons why they should be here and why they should share our concerns and why they should want the same answers that we all want. They owe the victims and their families an answer. So thank you very much for what you've done. We truly appreciate it.
Thank you.
Any other senators? Assembly people? Okay,
yes,
Jenna.
Senator, yes, I do have a question for Ms. Miller. Ms. Miller, first of all, thank you so much for being here. And I commend you on your courage and your heroism in light of all that you've done for the state and for the families as well. So thank you. Let me just say that since last March, no one from the Department of Health has ever testified before any state legislative committee to answer our questions about what happened in our nursing homes. And once again, no one from the Department of Health will be here today. My question to you is, what do you think of all of that as a resident and citizen of the state?
I find it outrageous. And I know, as I mentioned in my experience, they were inaccessible, really. I mean, and I can tell you from frustration as well, not just from the families, but also the staff whistleblowers. There was one subacute 2 employee, for example, and this person was so frustrated with Commissioner Persicilli and asked me, and it was something I actually sent over to the Department of Health, and they never responded. when is she going to get off of her podium and get back into the trenches with us? Because she has no idea what's going on here. Although I believe she does, and she's just burying her head in the sand and doesn't want to deal with it. I keep calling this senior genocide. This is what was committed in these nursing homes. And I believe Governor Murphy and his administration, including that Department of Health, was a part of it. It was also upsetting to learn. And I chewed out the ombudsman after my story broke about the bodies. And I said to them, I came with you. It was a warning, basically, that I came with to your departments, because I didn't know if this was allowed or not during a pandemic to have. I knew right away that this was not right to have these people being put in, the threat of people being mixed in together. And one of my whistleblowers told me, because, I later heard that on March the 30th, they did have their first case there, and they had set up a COVID wing rather than taking people from the outside for their own individuals. But eventually this person who I spoke to, this one whistleblower, said to me, what COVID wing? Everybody's all mixed together. And I had this information. I kept trying to contact the Department of Health after this initial email that I'd sent and this initial call, and I could never reach anyone. And the ombudsman, I don't know if, this was also a deflective technique to tell me that they could not go into a long-term care facility where there was a complaint. But that I find is also outrageous. I find both of those departments in particular quite outrageous, when so many people needed them. Families couldn't reach them. Staff members, I know there were whistleblower staff members that, they're still too afraid to come out on the record because they feel that, their careers would be ruined. They were all fearful of termination. And in the articles, it was always prefaced that these people have come forward, that we know their names. Their names were withheld, but they did not want to put their names out there publicly because they were afraid for their jobs, their safety. They were feeling threatened. So it's very unfortunate, and I don't know if there's any way to criminally go after them. I also find the Attorney General's office, I don't understand what happened to that investigation that they were supposed to be doing in May. We have not heard a word about that. And that's another thing, that another agency that I think should be looked into, and what's going on with that. We're almost a year now that they declared they were doing an investigation, and they haven't followed up at all with the public.
Thank you. Just one quick additional question, and then I'll stop. I know what I would ask Commissioner Persicelli if she came before our legislative committee. But if you had an opportunity to speak to her, what would you ask her?
What would I ask her? I'd have a lot of questions to ask her. How can you sleep at night would probably be one that I would ask, along with all of the other obvious questions, like the whistleblower asked, when are you going to step down off of your podium? Because that's where she's been all of this year. When are you going to step down from your podium and into the trenches? Because you were needed there. But she would get a lot of questions from me if I had her ear.
Well, I appreciate your time, and I appreciate all that you've done. So thank you.
Thank you.
Thank you, Assemblyman. Seeing no others, thank you, Jennifer. Thank you, Ms. Miller, for your testimony and the insight that you gave this committee on such a tragic event. Thank you. Next up, we have Mr. Osborne, Glenn Osborne. Mr. Osborne, tell us a little bit about yourself. I understand that you're connected to Menlo Park.
Yes. Hi, my name is Glenn Osborne. And I've been a resident at Menlo Park Veterans Home since September 1st, 2016. I'm currently the elected president of the Menlo Park Veterans Home Resident Council since January 17. I'm an honorable discharge veteran of the Marine Corps and have worked in the pharmaceutical corporation for over 20 years, mostly for clinical trials in melanoma. I'm a human being that's been deeply hurt and mourning because I have lost more friends and fellow residents during this past year than I ever did during my military service. These deaths should have been avoided. I did my best over the months to try to help my fellow residents and the family members who would call me night and day what is going on with their loved ones. Still today, it is very difficult to realize that I have lost more than half the residents on my unit alone. From 57 to 27 residents were lost due to COVID, but many of them were said they died due to pneumonia while they were in the hospital. I would overhear this by the physicians speaking at the nurses' station. As of mid-March, Menlo Park Home had 309 residents. And sadly, there are only 167 residents left. The Menlo Park Veterans Home has officially reported 62 COVID deaths. And based on the years at this Veterans Home, there has only usually been 8 to 10 deaths per month due to normal passing. Therefore, the numbers do not add up. They were simply too many deaths too fast. Many of the residents died were written off as having pneumonia without even being tested, and therefore not appropriately counted as COVID victims. Even in combat, you would want to be counted where you died and how we died for accuracy, for military records, and for the benefits of our family members. These deaths are absolutely avoidable in my humble opinion. My deceased friends and their families deserve better and need to know what happened. But yet the administration does nothing. In March and April, I asked the CEO and the assistant CEO whether there was any strategy in place to combat the COVID victim. In particular, I asked the CEO and assistant CEO about their strategy to get PPE and to cohort residents. The response I received was that they were working on it. I asked additional follow-up questions, but never received responses. The administration told me and the fellow residents that there was no need to worry because there was no COVID in the building. In March and April, I observed executive staff not wearing PPE while standing side by side, but ordering them and mandating the residents to maintain 6 feet distance. I observed senior members of the administration physically removing PPE from the storage cabinets. I confronted the staff and asked them why, and asked them to please wear PPE. Even I knew the importance of infection control and proper protection of gear, but they told me that they were not allowed to do so. Such hypocrisy, I thought. And now this administration is bringing back a prior ACEO after what had happened here. Do you know what that makes us feel like? And and have an idea what we're going through? Now we are going to be faced with the constant reminder who led us into this horrific, horrible pandemic in our lives. The problem still exists here at Menlo Park. And now it seems like only the proper authorities are not listening to us. Only the minority political representatives who care to listen to what we have experienced. It feels just like they are left us here to die during the height of the pandemic. the majority rulers and politicians care about us. That's how we feel as veterans here. So many good men and women here at the Veterans Home who fought and sacrificed their lives for you as the representatives of us citizens is a disgrace. We need somebody to listen with a purpose, to hear our voice, and to hear what we are saying is not on deaf ears. I confronted the CEO and I told them we do not want staff to be here that was here during the pandemic, as they did nothing to protect us. They would wear improper clothing and they would put us back into the same rooms as with infected residents. The other thing that I observed was residents returning from the hospital only be put back in their rooms with their previous roommates, as opposed to being segregated or isolated. There was no COVID section in this facility until late April, early May, when the VA nurses arrived to help organize the facility. I am not afraid or too prideful to admit that I come before you with trepidation and fear that I have been targeted already with retaliation for simply telling the facts. This is not fear without real basis. I promised myself and my fellow residents, when elected president of the resident council, that my goals would always be to simply help the residents who could not help themselves. I always tried to speak for those who could not speak for themselves.
Thank you, Mr. Osborne. I assure you, your conversation today did not fall on deaf ears. I also want to extend to you, if you feel that anybody is issuing reprisals against you, you let this committee, you let myself know. You had touched upon Mr. Mueller and his reward of being named the CEO now of Veterans. We're going to talk about that briefly, but because of time constraints with the next witness, we are going to go on to Mr. Mallett. So please, you're welcome to stay on. Thank you. Next up is Richard Mallett.
Senator Pernaccio, I just wanted to say one thing, please.
Quickly, please.
Okay. Mr. Osborne, thank you for your service. We all appreciate it on this panel. Our veterans deserve better. Thank you so very much.
Thank you for listening.
Thank you. Thank you, Senator Testa, for those very true remarks. Richard, please tell us a little bit about yourself and the organization that you represent.
Hi, thanks so much. And thank you for inviting me to provide testimony today. So my name is Richard Mallett, and I'm the Executive Director of the Long-Term Care Community Coalition. We're a nonpartisan, nonprofit organization dedicated to improving care and quality of life for residents in nursing homes and other residential care settings. In addition to being a researcher and advocate for better care, I've also been a family member of nursing home residents in New Jersey several times over the past decades, actually. As I think, a lot of what I've heard so far today and what I wanted to focus on as well in my remarks is that unfortunately, there is plenty of blame to go around for what happened in New Jersey nursing homes at every level. Fundamentally, our nursing homes have been failing residents, New Jersey families, and taxpayers for decades. And they were woefully unprepared, as we've seen, to provide the best protections possible for vulnerable residents in the face of COVID-19. Federal data indicate that 75% of our nursing homes were seriously understaffed when the pandemic hit. And again, that's a decades-long problem. A Government Accountability Office reported last May and they found that 82% of nursing homes had infection control deficiencies in the 3-year period prior to the pandemic. Our own studies of nursing home quality and state oversight have identified significant, persistent problems with both care and oversight, with the New Jersey Department of Health being one of the weaker state agencies in respect to protecting residents and assuring the appropriate use of hard-earned taxpayer dollars. DOH's weakness in this regard existed long before the Murphy administration. On the bright side, I would say, unlike some other states, leaders in New Jersey acted swiftly to identify the problems that led to the decimation of our nursing home residents and took decisive action to address some of the most significant problems, particularly in respect to staffing and accountability for the public funds that pay for the majority of nursing home care. And I do recall they spent a little time talking about some of the profit incentives, et cetera, and that's something that we focused on a lot too. In addition to swiftly implementing these important policies, however, we are calling on New Jersey to revamp and revive the Department of Health so that it truly fulfills its mission to protect nursing home residents. We must break the longstanding pattern of DOH protecting the financial interests of the powerful nursing home industry over the well-being of vulnerable residents. We owe it to those we lost and to current and future nursing home residents and their families. Thank you for your time, and of course, we'll stay on to answer questions or any comments you have. I also wanted to mention that for more information on some of these issues, including the financing, the quality, et cetera, I welcome you to visit our website, nursingHome411.org. We have information on quality and staffing for every nursing home in New Jersey by county and by city. So it's useful information, but I think both for you and for your constituents. Thanks.
Thank you. And I do have a question because of your in-depth knowledge of the nursing home industry. Jennifer Miller had pointed to a graph and a chart that showed that New Jersey led the nation per capita nursing home deaths. She had mentioned some other states. She did not mention Florida. And I like your comment on this because I'm going to give you some census numbers with Florida. And I'd like you to let me know the difference in the way that Florida handled their pandemic with regards to nursing homes as opposed to that we did. Florida is 2.5 times the size of New Jersey. They have roughly 22 million people. We're quite shy of 9 million. All those issues that you mentioned, those global issues, such as infection control and staffing issues, those are global issues. And they're shared, not only, that's not unique just to New Jersey, but also shared with states like Florida. Am I correct?
Well, I just want to say that that comparison has been debunked as being a false comparison. PolitiFact, I think, actually did an assessment of it, and they found that it was very faulty. There's really no, frankly, accurate or appropriate way to compare Florida with New Jersey. We had an outbreak first of all, we had an outbreak much earlier, as we all know, and as we're talking about and mourning to some extent this morning. And so that did not happen in Florida for months. And so again, the issues were different in terms of PPE, in terms of availability of testing, very, very different. And it's just not a fair, or frankly, I think appropriate comparison.
Well, the order to infect those nursing home residents was given early on March 31st. And according to the administration in Florida, they did the opposite. They segregated patients, they supplied the PPEs, they didn't force that virus into the facility. Okay, so there was a difference in administrative policy between Florida and us. And the numbers themselves speak for themselves. We're not talking apples and oranges. We're talking about a state that has twice as many people in their nursing home census that New Jersey does. And yet, the amount of people that die per capita are my goodness, 60% less in Florida than they are in New Jersey. You don't see any difference at all in those numbers, and any difference at all in the way that New York and New Jersey handled those COVID patients in nursing homes as opposed to Florida and other states did.
There are differences in numbers, and there are certainly differences in state policies. But again, and as I think PolitiFact had also found, that it's just not an appropriate, frankly, comparison. I have to be honest about what the data show, what the timelines show, et cetera. And that's just, it's just not a meaningful comparison, frankly.
Well, do you know that Florida counted residents depending on where they died, as Florida nursing home COVID deaths? And do you know that Florida also counted staff deaths as Florida nursing home deaths? Are you aware of that?
Well, everyone is counting both staff deaths and resident deaths. And I think, as Dr. Smith said when he was talking about it earlier, and I'm not clear either, I know that New York obviously has gotten a lot of heat for not reporting those deaths. I don't recall, and again, neither did he, as if New Jersey had a policy that mimicked New York. But from May on, and again, that's kind of, it hadn't really hit Florida in May, but from May on, this has been required by the CDC and reported publicly by the Centers for Medicare and Medicaid Services. So it's again, the time frame is very important here, both because of how badly we were hit in the tri-state area early on, well before any other states, and also because of the development, the recognition, the development and the availability of both PPE changing over that time period and of testing coming about and changing over that time period. So it's really, it is, yes, deaths are the same, and deaths are, of course, extremely unfortunate. And as I said at the start, there is plenty of blame to go around. But frankly, I think that the major things that I've been hearing over the past almost 2 hours now really reflect on the Trump administration and the failures by the Trump administration, by CMS, to adequately address these issues. And that left it up to the states, and that was unfortunately very, very imperfect.
Wait
it's not excusing the state at all.
You have a governor that's ruled by edict for 1 year, okay? He can step aside and he can co-rule with the legislative branches, as which was the constitutional setup in which the state was initially intended. This governor ruling by edict, and now this you're saying this governor had 24/7 control of what was going on, and you're blaming it on the federal government. Did the federal government give us the USS Comfort? Did the federal government give us the Javits Center? Was there anything that this governor asked for from the federal government that we did not get? Whose edict was it on March 31st that forced those patients into nursing homes? That forced, is there any science behind that testing, prohibiting testing with those patients? CMS, CDC.
I'm not here to represent, that's clear. Let me please finish. I'm not here to represent, and I can't possibly get into the thinking of the governor's office. As I said again at the start, there's blame to go around. Let me finish, please. There's blame to go around at every level. However, the Trump administration, all the directives about going into nursing homes and doing inspections, that came from the Centers for Medicare and Medicaid Services and the Trump administration. The way the money was given out to nursing homes and to the industry and to states, that again came from the stimulus packages from Congress that were then funneled through the CMS. Some of those policies, I think, were somewhat beneficial, but for the most part, I think they were very poor. And I think the dereliction of duty in respect to taking the pandemic, the bull by the horn, so to speak, particularly in regard to nursing homes and particularly in regard to holding New Jersey Department of Health more accountable. I mean, I think you're right. New Jersey Department of Health has a critical role here. But again, my issue, frankly, from the very beginning was, and this includes with those directives that you have rightfully criticized about taking in nursing home residents, they did not force the nursing homes to accept residents. They counted on the residents only taking residents for whom they could provide safety and appropriate care. That's accurate. That is exactly what happened. And the issue here is that the New Jersey Department of Health never holds facilities accountable for ensuring that they only take in residents that they can provide good care for. And that's something I personally experienced, as I mentioned before, but that we've seen and studied and data show over the years. So why would the industry, which is mostly operated for profit in the state and nationwide, why would it suddenly think that it was going to be held accountable for meeting those minimum standards when it never has been? But as Dr. Smith was saying earlier on, we had, well, he didn't quite say it, but he did say the infection control is not brain surgery or rocket science. And that's true. But as I said in my testimony, the GAO found that 82% of nursing homes had violations for infection control. As one of the earlier conversations talked about the WANAQ. Why weren't nursing homes being held accountable leading up to the pandemic? Those are appropriate questions, I think.
Okay, well, Thank you for your testimony. We'll be moving on, but again, we've had this testimony not quite shy 2 hours. The actual quotes from CMS and CDC were read. The actual quotes from the state directives dated March 31st were read. And quite frankly, even according to Dr. Smith, they're contradictory in nature. Thank you very, very much. Next up is going to be Mark. Mr. Osborne, we're not going to forget about you. You stay right there. Mark Stratoti?
Stratoti.
Go ahead. Tell us a little bit about yourself.
Okay, I've been a nursing home administrator now since 1996. Most of my career has been spent in Cumberland County Nursing Home, which no longer is has the leadership of the county. With that said, during the year of 2020, when the pandemic hit, I was employed at Eastern Pines in Atlantic City for approximately, at the time that the pandemic hit, it was 6 to 7 months in. During that time, when the masks started to be worn and the restrictions were implemented, about a month into that directive, I was asked to take on some COVID residents in our nursing home. Now you got to understand, at the time, we had no COVID. We had no way to cohort COVID. We were asked to cohort COVID residents. I was in an older building with no separate wings. I had rooms that had multiple beds in them versus the single occupancy. I balked at the fact that the leadership wanted me to take COVID when we had no COVID in the building. So I balked. I didn't actually say no, but I hesitated, and then later on gave my reasons why I didn't want COVID in the building. With this new disease hitting at the time, it was very unknown of all the things that could happen to a person, and things seemed to be pretty bad at the time that the disease had hit. With that said, we had a sister facility across the way in Egg Harbor, which was a newer building and could house COVID residents that could be separated from the population. So what this organization did was they transferred some COVID patients down from their other facilities to try to minimize their infection rates in their buildings. And because I balked and said no, they sent them to that other building. Lo and behold, they sent, I believe it was 9 or 10 residents. COVID spread within that building, and they had up to 10 deaths in that building. I still maintained that I did not receive any COVID residents, and from that point on, I didn't receive any. Within a month of that time, I was let go due to, with no warning. They just said, we're going in a different direction. I believe it was due to the fact that I wouldn't take COVID residents.
Any questions from any of the staff members? Anything else that anybody wants to add? Thank you for your testimony.
Senator Panaccio, just real quick, real quick with Mark. Does he have any the communications or anything like that occurred between, say, the Department of Health and when he was the administrator?
When you say communications, at what time frame or
during the time, during right around, say, when the executive order had come out or anything, or prior to, or any kind of communication that this is what the state's planning to do? Yeah,
they had come out with that first small executive order, and I don't recall the number, but that was when PPE was short, and we were scrambling to get masks. That was a mask issue back then. Right. The only communication I really had was with the local people, the OEM fellow from the Atlantic City. I was in direct contact with him several times. Department of Health, I really didn't have much direct communication with them due to the fact that there was so many people on the phone and so many people trying to communicate. There was really nothing for me to ask other than to read the directives that were sent.
All right, thank you. I know into my office, many were actually not my office, but also my cell phone or whatever, lots and lots of calls coming about how can we get PPE, how can we get PPE, knowing everything was short. But
well, that's why I kept it at the local level, sir, because they couldn't answer the question. I wasn't going to waste my time calling them.
Understood.
The lady that needs no introduction couldn't help me. I could not get a hold of her at all.
I appreciate it. It was just emphasizing the fact that everybody knew that the PPEs were very scarce.
Correct.
And the whole idea of the isolation and whatnot. But if there's any communications that you, and going back and see that you may have received that hasn't been, publicly, it wasn't a public announcement, some of this, this committee would certainly appreciate any kind of information that may have come into you or any of the in the facility that you had, you might still have access to, because obviously we can't get any yet. So thank you very much.
Okay, thank you.
Mark, I just have one question before we let you go.
Sure.
Because you were reading all the correspondence, familiar with the CMS, CDC guidelines, and then you got the state guideline dated March 31st, where you were could not deny those patients entry, as well as not being able to test them. How did you feel when you read the second guideline? Then you say, wait, there's a contradiction to the first guideline from the CMS and CDC. Did you try to pick up the phone and call somebody and express your concern that they weren't parallel with each other?
No, I didn't do that because I was too concerned with the infection and keeping people safe at that time. I did. When I spoke to my leadership and expressed my concern with taking people with COVID, they just says, well, we have to do it because that's what the order was. And I'm like, well, you're compromising everybody. I'm not going to take residents here. That's when I put my foot down more. It's funny because the leadership at that time, she was compromised, the woman in charge. She was on a breathing machine. She didn't even step foot in the facility the whole time. She was never around. So it's interesting how you're going to give us the directive to take the COVID, and you're not even going to come to the building because you're compromised. You're going to work from home.
When did state inspectors finally come to your location?
I was not there during any state inspection. I don't know if they came afterwards when I was gone, because I was gone by the end of April is when I left. I don't know if they had any inspectors thereafter. I did do an interim stint in Jefferson that summer. They did come in June, the state inspectors, I can tell you that. It was for an infection control inspection only.
It was reported that they didn't start inspection until April 16th, but you're saying your facility, if they came, it had to be towards the end of April, even further on than that.
As far as I know, I left April 20th and there was no inspection done by April 20th.
Okay. Thank you, Mark. Thank you for your testimony.
Senator Panaccio, I have a couple of points.
Yeah, I'm sorry. You have to raise your hand if you have a question. That way I know that you want to ask a question. Go ahead, Senator.
I apologize. Mark, if I understand your testimony correctly, you actually kept COVID-19 positive patients out of your facility. Is that correct?
Yes, sir.
And there was no outbreak at your facility as a result of that, correct?
Yes, sir.
Okay. And then the other facility that let patients in who were COVID-19 positive, they had an outbreak and resulting deaths, correct?
Yes, sir.
Okay. So your efforts saved lives, correct?
I believe so. Yes, sir.
Okay. And instead of being applauded for your efforts, you were punished?
It seems so. I'm not employed.
Do you feel you were retaliated for your actions?
Yes.
Thank you. That's all I have.
Thank you, Senator. We're going to bring back Mr. I'm sorry. Anybody else have any questions on the panel? Okay, thank you. We're going to bring back Mr. Osborne because I know Senator Corrado has a few questions relative to staffing and Mr. Mueller that she'd like to ask and get Mr. Osborne's feedback on it.
Thank you, Senator Panaccio. Mr. Osborne, I want to thank you for your service. Quite honestly, your testimony was heartbreaking. I heard you testify once before the Health Committee. It was hard to hear then, and it was hard to hear today. And when you're telling us that you lost more friends than you did during the time you served, that the massacre of veterans occurred not on the battlefield, but right in our backyard, that is completely unacceptable. And what's even more frustrating, it was completely unavoidable. So I thank you for what you're doing and speaking up for your friends now. In the beginning of the, I'm sorry.
Thank you for listening. It's important to us because we feel all alone and left out.
You are not alone, and we hear you loud and clear, and we want you to know that. You know, in the beginning of the pandemic, we know that staffing was an issue at the veterans' homes, and now we've read articles about how the staff was explicitly prevented from wearing PPE. Can you tell us a little bit about the shortages, how chaotic that was in March and early April?
Yes, we were I actually witnessed PPE equipment being brought into the nurses' station, and most of it came in through the National Guard support at the time. And it was locked up into cabinets, and they were not given the equipment. And I asked the CEO why this was not permitted. We have the equipment. This is just basic, you know, sanitation and control. And she said, we do not want to frighten the residents. And to this day, we even have some of that. So some of the staff at that time would put on plastic garbage liner containers to protect themselves. And they were told to bring in their own mask and wear it for all week long. I mean, what's the point? They were going from room to room with residents who were already infected that I even was aware of. And when they were brought back from the hospital, they were just commingled back into their original room with other healthy residents.
Did the administration, the management at the home ever offer PPE to the residents like yourself?
No, not even masks.
Did you know, we now know from newspaper articles and emails that were secured through open public records request that management at the 3 veterans homes were working with the administration on a sliding punishment scale, that if, you know, the healthcare workers or the staff bought their own PPE, and first time was a verbal warning, second was written, third was suspension. Did you know any of that was going on in the beginning?
Several of the staff members would come to me and share their burden about that they were concerned, not only for us, but for their own family members they had to go home to, and they did not want to spread the virus. And they were told they were going to be punished. They wanted to know how it could help, because I'm known around here as the troublemaker.
That's a good thing. You know, we also know from these newspaper articles that approximately 25 to 28 staffers were suspended during the crisis, you know, when it was at its height, and none of these suspensions were upheld. Did you know that this was going on as well?
I heard that, but I was also told by the administration that many of the staff members refused to come into work because they had no protective equipment. But staffing has always been an issue, a concern here at all these veterans homes and others, especially for weekends and holidays. We're always reduced staff by at least 25%. When we should have 6 CNAs, we would have 3 or 4 at most. So, and the reason that's important, because the veterans and residents would be left in their beds or wouldn't even be cleaned or changed during the day of the shift when they had not inappropriate or reduced staffing.
So we knew staffing was a problem before the pandemic, and then we put the people in an impossible situation of choosing between their jobs and getting their families sick.
That's correct.
So you must have been pretty shocked to find out that Mr. Mueller was going to come back and run the Menlo Park home.
Where the veterans here are really frightened. First of all, we still have some mid-level management people who were part of the problems, especially when they were dancing in the hallways to music, literally as the residents were dying in their bed because of COVID. And now we're bringing back the assistant CEO of nursing, who was a decision maker in the way things are handled here. It does not make sense to us. Why are you bringing back, even from a mental point of view. It's a burden, it's a hardship, it's a frightening vision to have somebody here that was caused some of the horrific problems that we had here and did not stand up for the residents.
It doesn't seem anyone was standing up for the residents except for you. And I want you to know that we did ask the Commissioner of Health and the Commissioner of DMAVA to be here today because we thought it was that important that they come and answer the questions that you and I and everyone on this panel have. And we're going to continue to push and make sure that they are held accountable. We want you to know that we heard you. We are continuing to hear you, and we will be here for you in the future. We thank you very much for everything you've done.
Thank you very much for listening.
Thank you.
Thank you, Senator Corrado. Mr. Osborne, just a little quick follow-up. First of all, thank you for your service, and and let's pray for all those souls that have gone. In the Menlo facility, there were 100 of 180, I understand, that perished. Menlo and the other veterans homes are unique in the sense that the state basically has total control over what's going on. They have some oversight from the federal government, from CMS, as do all nursing homes. But I know early on the administration was going after, quote, the bad actors. State of New Jersey can control Menlo Park, Paramus, of Vineland. So they're bad actors also. You had mentioned the co-mingling of COVID patients. While this was going on, did any of the staff members, anybody, doctors, staff members, administration, anybody express to you or to the other residents there of their concerns with the commingling, or were they just following edicts?
Well, they absolutely were concerned. They used to complain to me privately. I'm talking about staff members and even residents and the family members themselves, because they would call all day and night to the nursing station, but nobody would answer the phone. I do not know if they were told not to answer, but I would, because I'm literally right outside the door of the nursing station, and the phone would ring for hours. So the family members would end up calling my personal line. And I would try to answer them, or they would ask me to go find their father and find out how he's doing and see what, if they could do anything. And yes, I did take the initiative to go out, and I'd go to other units where I know I wasn't supposed to, just to see how their family members were doing. Most of them, thank God, were doing well, but others I would tell the family members, get them out of here. Take them home, do something. I don't know what to tell you.
Ms. Osborne, you had mentioned some did show concerns. Did they ever mention any of these administrative personnel who they felt was handcuffing them, that some of these edicts were followed out contrary to good medical and science and infection control?
Well, the CEO even told me at the time they were getting their orders from the Department of Health, and it was coming from above.
And the CEO was who?
Elizabeth Schiff Heedle at the time.
Okay, and Mr. Mueller had a different position, I believe, at
He was the assistant CEO.
Okay, it's safe to say that he knew what those edicts were, and
absolutely, they had offices side by side, and I know that they had executive meetings every day, sometimes twice a day.
Okay, so ultimately their handcuffs themselves were coming from Trenton.
Yes.
Okay. Any other questions from anybody? Yes, Assemblywoman DeCross.
Thank you, and thank you, Mr. Osborne, for everything that you have informed us about today that many of us have heard and have talked to you prior to today. As Senator Panaccio referred to bad actors, in my opinion, those bad actors has now created a crime scene at these facilities. And I think that's a disgrace. And I think that it certainly does merit everything this panel can do. And the federal government and anyone else involved needs to be involved to take a good hard look as to what happened. So I thank you for saying what you had to say today. and let all of us know what actually was going on there. Thank you.
Thank you.
Anybody else? Yes, Ms. Osborne.
Just so you know, I was actually told that the Attorney General of New Jersey was going to have an interview with me, but that has never happened over. I was told this about 3 months ago.
3 months ago. Okay. Thank you again, Mr. Osborne. Our hearts go out to you and everybody that suffered in Menlo Park. And thank you once again for your service. And probably one of the most important testimonies that we had this morning. Thank you.
Thank you.
Okay, next up is Phyllis Florick. Do we have a video on Phyllis? Is Phyllis on?
She's on, but she's muted.
She is, but she's on mute. Yeah.
Okay.
She's on mute.
Can we tell Phyllis to unmute herself, please?
You got it, Phyllis. You're on.
Phyllis, we can't hear you. You may need to turn your volume up, but you're off mute for sure.
Okay, we'll give you another 10, 15 seconds. Do we have Muriel Smith on deck?
Good afternoon, Senator.
Okay, Muriel. All right, we're gonna give Phyllis.
Good afternoon, Senator. First of all, I want to thank you very much for conducting these hearings. It's got to be heartbreaking to you to hear all these stories. I want to thank my own Senator Declan O'Scanlan and my Assemblywoman Damaso, because they've both heard all this from me. They promised me that they'd do something, and I'm delighted to hear that they are doing something. It's the first confidence I've had that, that things are going to get better. By way of background, I am an ombudsman, a patient advocate in 2 different nursing homes in Monmouth County. The one that I am in most often happens to be 3 miles from the governor's house. And the governor has never been there. I'm sure he's never been there. And he's never seen how great that nursing home is and how hard those people work and what agony he put all these people through. When I heard in March that this nursing home was forced to take back patients who were patients in the hospital without any tests or whether they had COVID or not, I knew something terrible was going to be happening. At the same time, I also am Catholic, and I happen to be, I give out communion at the county jail. And while the sheriff isn't my close friend and doesn't do everything that I think is correct, he didn't let me go in and bring communion out. So I was frustrated because the prisoners had more protection than my people who were my age and older in nursing homes, who were in nursing homes for their own health. They didn't get the same protection that my prisoners in Monmouth County got. That annoyed the heck out of me. There was a group, I also write for a newspaper, a weekly newspaper, and there were a group of kids that wanted to go to the local hospital to put signs out to say thank you to the nursing staff, because these kids knew what nursing staffs were going through. They couldn't even go into the lobby of the nursing home because the nursing home was that protective. But yet my governor was forcing my nursing home to take back people from the hospital, not knowing whether they had COVID or not. It was frustrating, to say the least, absolutely frustrating. In April, a close friend of mine died. We had to be seated far apart in the funeral home. When we got to the mausoleum, we couldn't even go in. We had to take turns going in the mausoleum. And yet, all these protections were being taken there. But for my friends, my people who were in nursing homes, you have to understand, everybody in a nursing home isn't ill. Some of them are there because they can't take care of themselves, but they have nothing life-threatening about them. And yet, some of my residents at my nursing home, I'm very possessive of it, but some of my nursing home residents there died simply because they were forced to live with other people who had COVID or were positive for COVID, or might have been with COVID. I have no idea, but my complaint is that my governor, and my term for him is Governor Murderous Murphy, because my residents didn't have the opportunity to have the health care that this nursing home gives them. In June, this nursing home let me go back in as the ombudsman so that I could visit with patients, so that I could see them. At that point, they were very advanced. They had separate sections so that residents who had COVID were quarantined from other residents. Well, I could go into that section, but I had to put my feet with shoes on through basins of water before I could come out of it. They were that concerned that there were going to be germs spread on the floor as opposed to anything else. I could not go into those rooms. The nurses going into those rooms had to have special, they had to change their equipment before they went into any room. And yet my governor was forcing them to take in people that they didn't know whether they had COVID or not. My thanks to you for all of this, because I think you're going to be making it public. I think it's going to be something that's going to make me feel that at least my friends who died in the nursing home are now martyrs. They died for a cause it's going to be more public. You're going to be able to do something for somebody, and for other people, I thank you very much. To that nursing home administrator who lost his job, man, you've got guts, and I'll admire you forever, and I thank you very much forever. To the reporter who did such a great job, good going to you. And to the Marine, of course you're speaking for all your other people. You're a former Marine, and that's what Marines do. As the mother of two of them and the mother of a sailor as well, I appreciate you and everything you've done. If I had any suggestions to make, it would be that you listen to some nurses, listen to some aides, listen to a couple of administrators who really have worked very, very hard. In my case, this poor administrator just came into the job the end of January or the beginning of February. She was so hardworking. She was so concerned. She did so much, and I'm sure that's why this nursing home today is absolutely COVID-free. From June until December, it was absolutely COVID-free. No thanks to my governor, but it was absolutely COVID-free. Today, I think there are a couple of employees that have tested positive because this nursing home is so advanced, they have removed them before anything else has happened. My residents are all safe. I also think the other reason why this particular nursing home is safe is because so many of the nurses and aides here are family. Some of the residents have been here 8, 10, 12 years, and they are family, and they treat them like family. We can't have visitors in there now. I can't go in there now, but we're a one-floor facility. This particular nursing home is a one-floor facility. So guests, family members can go outside the window, and the aides help them with video screens and everything else that they need so that they can talk to each other and we see each other. So now I feel that you, Senator, are certainly doing something, and I can't thank you enough because it's been very painful for me to lose friends in the nursing home that were only my friends because they were in the nursing home. But you're going to help everybody else now. You're going to help my new friends that are in the nursing home. And thank you very much for all of that.
Thank you, Mary, for all that you do as an ombudsman. I just have a few brief questions. Did the residents know? You had mentioned quite a number of times, and you emphasized forced virus in. Did the residents know what was going on as far as people coming and going that had COVID and how they were being commingled, or concerned about being commingled with those residents?
I'm having difficulty hearing you, Senator, but if you were asking, were the residents aware of what was going on during this whole time? To a degree, yes, they were. They had access through window conversations with their family members, and family members told them things. This particular administrator went around and talked to residents in their rooms. The recreation staff ran bingo. They ran up and down the hall screaming out bingo numbers because the residents had to stay in each of their own rooms, but they thought that recreation was important to them. So yes, I do think that they were aware. They were frightened. They were underweight and they didn't know the whole story, but I think that they were kept as much aware as they possibly could have been.
Are there any questions from Muriel?
I'd like to chime in if I could, Senator. Muriel, I really just want to thank you. This is Senator O'Scanlan. You've been a rock star from minute one in being an inspiration and a voice for not just you, but every single senior in every single one of these facilities. You are incredibly articulate. Your courage and tenacity are amazing, and your perspective is spot on. And know now that through today's procedure here, that your voice has been heard all over New Jersey, loud and clear, and we're going to continue to deliver your message. So on behalf of myself and Assemblywoman DeMasso and Assemblyman Scharfenberger, we love you. Keep speaking and always let us know if you need anything going forward. But the fight continues, considerably inspired by you, Muriel. You're amazing, and thank you on behalf of everybody that you represent and all of us.
Thanks a lot, Senator. You know you do hear from me when I complain about things, but you always resolve them. I appreciate it. Thanks, Senator.
We love you.
Anybody else?
Just real quick.
Senator, go ahead.
Yeah, thank you, Chairman. Just real quick, Muriel, thank you very much for your comments and your testimony, and particularly about the issue about the healthcare professionals and nurses there. I was a former. I would be calling bingo for the Knights of Columbus. I know how important that is for people get very excited about the bingo games. I used to get commented that don't go too fast, don't go too slow, So, but thank you for bringing up the nurses. As I said before, my mom was a nursing home for more than 30 years, and we had a nurse that was going to come and testify here today, and we know that they feel so personal, as you said, when they lose somebody and not being able to interact with the family members, and they were their family members that were there. We did have a nurse that was hoping to testify today, and we know you all are taking a risk of any kind of retribution or anything like that, but unfortunately she couldn't change her schedule, so she's going into work, and she's making sure that she takes care of her residents. And it was interesting. My mom said, "Steve, we didn't call them patients. We call them our family members, our residents, and whatnot." So I really appreciate you bringing that perspective in, because I know my mom is 88 years old, and she worked probably until about 6 years ago, and quite frankly, she absolutely loved all her residents, and she called them family members. But thank you so much for bringing that kind of perspective. Thank you.
Thank you, Senator. Thank you.
I do want to thank your kids too, Muriel. It's not a surprise to me that genetically and spiritually you created offspring that are now serving their country. Not a surprise at all. So thanks to them too.
Thanks again, Senator. I appreciate it.
Thank you,
Senator, if I could have a moment. Muriel, thank you so much for being here and for your courage as well. I'm so sorry for the losses that you have suffered. So my condolences to you on that. You've made a big impact on this committee. You were thanking us before about what we're going to do now to correct some of these failures, but we can do that because we've heard from you and you've had an impact on us. So thank you so much.
Thanks, Assemblyman. I appreciate that.
Thank you.
Thank you again, Muriel. Thank you very much. Next up is Phyllis Clark. I understand Phyllis is going to be giving us testimony by phone. Can you hear us?
I am.
Okay.
Can you hear me now?
We can hear you.
Thank you, and I apologize for that. Good morning, Senator Panaccio and committee members. Thank you very much for the opportunity today to share my personal experience and thoughts regarding the situation that occurred with COVID in the nursing facilities. My mom, Sally, passed away on April 15th, 2020, in a nursing facility, and a death certificate was issued with COVID as the cause of death. Let me begin by telling you a little bit about my mom. Mom was born in Wilkes-Barre, Pennsylvania in 1920 and would have turned 100 on her birthday, August 1st. Plans for a family reunion to celebrate this milestone were all in place. There was a realistic expectation that Mom would achieve 100, as her only medication was a high blood pressure pill, and she had no aging mental issues. She was confined to a wheelchair for knee and leg issues. Mom came to New Jersey as a teenager to find work during the Depression, having been one of 9 children with few economic resources. She was the last surviving sibling. In her early 20s during the Second World War, Mom worked at Western Electric, slicing quartz crystals to support the Allied war efforts. She was very proud of this job, and to her death carried with her a picture of her and an article in the Newark newspaper at the time, the Sunday Call, with an article that had been written about her. Mom lost her first husband in her late 20s when he returned home from World War II and was diagnosed with terminal cancer from his position as a gunman on a ship in the European theater. In later years, she remarried and went on to become a bookkeeper and worked the rest of her life until retirement. I am an only child. Mom lived independently until she was 95 years young and took a fall, after which she could no longer walk and subsequently needed the care and support of a nursing facility. She entered a nursing facility in January 2016. I'd like to make a few comments about the environment in her nursing facility prior to COVID. I visited Mom virtually every day, so I was able to observe quite a bit of how the facility operated, as well as to get to know personally a good number of the staff who supported my mom. Pre-COVID, my comment on the facility, which I am going to state here, is a good facility. Prior to that, I always said that the facility in the scheme of things was sufficient only if a resident had no actual medical needs outside of a very low level of care, such as pills, bathing, assistance eating. For residents who may have needed higher levels of attention, it was my opinion that the facility had neither adequate staffing or the level of medical expertise during long periods of the day, and certainly not during the 5 p.m. to 8 a.m. shifts and weekends. This included doctors, nursing staff, and aides. Additionally, specialists for audiology, podiatry, ophthalmology had long lead times to schedule appointments. I was there every day with outside food to be sure Mom had some edible nourishment. Additionally, mental health supporting activities were extremely limited due to a lack of dollars. The facility recreation director worked very hard to bring activities and cheer to the residents. Another issue that I constantly observed was the small rooms with the 2 people in them and the shared bathroom. I emphasize here again, my mother was in a good facility. My point in sharing with you the pre-COVID environment is to set the stage for what occurred once the infection started. In January of 2020, the facility had masks at the front desk available for visitors. Few, if any, visitors used them and no staff. In the beginning of March, we were aware of COVID. There was no communication to the families of an infection control plan being initiated, and in fact, I believe even then they were flying blindly. There were rumors within the facility of a COVID-positive individual having been admitted. I asked various members of the staff why they weren't wearing masks at this point, and was told they were uncomfortable. The facility director on March 10th indicated the staff did not need to wear masks, as they were advised to stay home if they had any respiratory issues. And at that point, there was still no limitation on outside visitation. On April 1st, the facility still did not have an adequate supply of masks or PPE. The facility was shut down in mid-March to outside visitors. The first week of April, families were advised that COVID was suspected or had been identified in the facility, and the first patients had been transported and had passed away. Since PPE was insufficient and staffing levels had begun to become more problematic as staff began to call in sick, they had 8 test kits of which they could use. Testing results at the time were taking well over a week. There was nowhere to physically move suspected positive residents to. Without telling me, Mom was tested because she would spike a fever in the morning, which would then go normal. At the same time, conflicting information was coming from the OEM. At one point, I was told that the OEM would not transport any potential patients from the nursing home to Morristown Memorial. This was clarified on April 4th by the director, who indicated that OEM would only transport if the patient required a ventilator. Otherwise, they could be treated successfully at the facility who could manage the symptoms. Clearly, no one could be treated successfully at these facilities with the existing staff levels, much less the declining staff levels and lack of PPE, drugs, proper oxygen equipment, etc. Basically, the facilities were left on their own to manage and the residents to die. People were dying at this point. Families could not get accurate information from the overworked staff. Phones were not being answered in the wards, callbacks were not happening. It was impossible to reach our loved ones who by this time were scared, malnourished, inadequately attended to, and constantly exposed to COVID. Hearing aids, dental appliances, glasses, etc. were no longer being ensured that the residents were using them, further degrading their isolated quality of life. Residents were restricted to the rooms, and for some, this was a death sentence, as roommates had not yet been diagnosed with COVID and they were in shared rooms. Doors to the rooms were closed, so residents could not wander the hallways, which meant that the caregivers could not see or hear what was happening to residents in their rooms. Other residents who refused to stay in their rooms wandered, and at least in one case, it was believed spread COVID. HIPAA laws were constantly referenced to tell families why no detailed information on their loved ones could be provided, including if their roommate had COVID. The morning of April 6th, I received a call from the facility that Mom had gotten out of bed and fallen and was being transported to the hospital for tests and observations. This happened during the woefully staffed night shift. Turns out that she had fallen twice during the evening trying to get out of bed to have breakfast. Being clinically blind in at least one eye with macular degeneration, she thought it was morning. They put her back in bed the first time. The second fall, she hit her entire face, of which I have the horrific pictures. She laid on the floor calling for help. She was transported scared and alone to Morristown. That same morning as she was being transported, the director of nursing called to tell me that Mom's COVID test had come back positive. They alerted the hospital. There were no updates during the day and into the evening from anyone. That evening, I received a call from a physician at the hospital. He indicated that she had no bleeding or brain injury. I asked him about the COVID, and he responded they saw no evidence of COVID, so they did not keep her and transported Mom back to the facility. Mom's oxygen levels were between 91 and 95. I begged the facility to allow me to put my own nurse or caregiver in at my expense to stay with my mom. They would not allow it. Alone and confused as to what had happened and why I wasn't there, Mom laid in bed. She wasn't eating. I had to request a drip for food. She lay in bed, and on April 11th, it was noticed that she had developed a stage 2 pressure sore. I had to request an airbed. Her oxygen kept fluctuating, and she kept pulling the oxygen from her nose. The facility did not have a concentrator oxygen machine available. They would not restrain her arms due to HIPAA and legal patient rights. They offered no experimental drugs. Clearly, and contrary to OEM, these facilities were not able to provide the same level of care as a hospital. I believe because she had a do not resuscitate in order that she may have been allowed to die. I sat outside her first floor window day and night from April 6th, and I watched her die helplessly. We were never warned in March when I could have found a way to bring her home. On April 15th, I arrived at her window and called into the facility and asked them to open it. They went into her room, and she was passed. What happened in these facilities is a disgrace and can never happen again. And that is my hope for this facility. Thank you.
Phyllis, I'm so very sorry for your loss. Are there any questions from any of the members? I just want to expand on one thing that just, we had spoken to a whistleblower and you had mentioned masks and PPEs quite a number of times. The whistleblower, fearful of reprisals, spoke to myself privately as well as staff. Surprisingly, he said that back in 2018-19, besides all the staff being decimated, we still don't know to what levels they were brought back up, that the state of New Jersey, both Department of Human Services and Department of Health, discarded over 1,095,000 masks. And the reason for them discarding the masks was that they had expired. CDC, a year before they threw the masks away in 2017, actually said that discarded masks still serve, masks with expiration dates that have expired are still perform effectively, and they should be visualized and they should be looked at before they're thrown away. And that guidance again was 1 year before, prior to 1 million masks that this whistleblower said that New Jersey has thrown away. And that's sort of important because the governor tweeted out on 10/29, we pledged we would not be caught unprepared when the second wave arrives. So of course the question shouts out, does that mean that we were initially unprepared? Ontario in 2007 had purchased 55,095,000 masks. And there's a report dated 2017 that more than 80% of the stockpile quota had expired, but they did not discard them. There was a few studies that looked into whether these masks, because they're basically inert. The issue with the mask, quite frankly, is a rubber band, whether the elasticity goes off or not. And that could be retrofitted with an additional band, and they did that, and they found that they work out to 95% efficacy, or you can just put that mask on and a surgical mask on top of that. So when we're talking about masks and when we're talking about PPEs, again, the questions that have to be asked, reference to New Jersey, related to us by this whistleblower was what was our stockpile? How many were thrown away? And as they were being thrown away, were they being replaced? Did they speak to the CDC? Because again, obviously they threw them away a year or two after the CDC recommended that you didn't have to throw them away. So I wish we could have gotten that whistleblower here, but the fact that you had mentioned PPEs, Phyllis, and masks, I wanted to get that on the record to show that perhaps we didn't have to struggle as much as we did in the beginning with PPEs. Does anybody have any questions for Mrs. Florek? Thank you once again for your heart-wrenching testimony, Phyllis. Thank you.
Thank you, Senator, and everyone.
Okay. Next up. Do we have Vivian Zayas? Is she next up?
Hello, I'm here.
Okay, Vivian, you got the floor. Tell us a little bit about yourself.
Sure. I am Vivian Zayas. I'm honored to be here with you today. Unfortunately, like many of the members who have been impacted directly, I am one of them, except that I, with my sister, started a group called Voices for Seniors upon the death of my mother. We were baffled and bewildered as to how happened to her 2 days prior to her discharge, being convinced the entire time that she was well and the doctors had supposedly cleared her to go home. We basically did not know she was COVID positive, did not know there was COVID in the facility. And so my heart goes out to the families here that are testifying so bravely to defend the honor and memory of their loved ones. So my sister and I started Voices for Seniors, trying to figure out what was going on in the state of New York. And we definitely have families that are in our New Jersey chapter, hoping that we will continue to spread the word and get justice for our seniors. And when I say the word justice, I mean, accountability. I mean answers. I mean solutions to the problems in our nursing homes so that this never happens again. So unfortunately, when my mother passed away, I was given a box with her name, and inside her box was her shoes and items that pertain to her. and my mission began then. So I know the heart-wrenching stories because I see them in the members of our New Jersey chapter. They have been bewildered and astonished at the silence in New Jersey. So I applaud you all for being here, for starting this conversation. And I hope that it is something that just is ongoing and that the cries of the families will continue to get louder. We went to New Jersey in the month of October, and to our surprise, there was no media, there was no noise, no one wanted to hear our stories, but we'll be happy to come back, and we just want to applaud you. So right now, I am just brokenhearted that the stories are not they're so eerily close to what happened in New York. And in some cases, they're more egregious. So I thank you for telling us stories, and I thank you for hearing our stories so that we can maybe make some changes so that our seniors are safe going forward, and that our families get a semblance of maybe some accountability, and that we can be able to go forward with our lives, not only honoring our loved ones, but caring and safeguarding the seniors of the future, which could be us. So I thank you again, and I look forward to hearing the stories of the other members of our group that will be testifying here today.
Thank you, Mrs. Zayas. Before we begin, do you feel disappointed that 1 year into this pandemic, that we're finally getting a hearing, albeit a partisan hearing, because the legislature, both houses, have refused to have those hearings?
I'm trying to hold back tears. So yes, I am disappointed. The members of my group are disappointed that New Jersey, Governor Murphy, and everyone in his administration has been pointing fingers and in many cases ignoring the cries of families. This is not like we lost puppies. We lost humans. We lost people who built our country, who were the backbones of our families, and that needs to be answered to.
Could you tell us who those fingers are being pointed to? Because obviously they're not being pointed to themselves.
Well, the first person that gets a lot of the blame is former President Donald Trump. And we know that he basically sent the USS Comfort. We know that in New York, we had the Jacob Javits Center. Not sure what other facilities were furnished nearer to New Jersey. But here we actually get it pointed in New York. We get the families get blamed for putting our seniors and our loved ones in these facilities. We've been called a death cult. We've been ridiculed for basically wanting to blame someone or find someone to blame, according to Governor Cuomo. So it's interesting dental advocacy here in New York. And when I hear the stories of New Jersey, I am just overwhelmed with grief that they were not allowed to wear PPEs and the protective things, and that they were commingled with other unhealthy, with other healthy patients. My mother, in contrast, was not a permanent resident, as many seniors are. My mother was receiving physical therapy. She was supposed to be there 3 weeks. And through the red tape of the insurance company, it became 3 months. And unfortunately for her and for us, she got locked down in the facility. And we kept telling her, Mom, you're going to be here just like 2 or 3 weeks. We're going to get you out. And the last memories that I have of her is slunched over in her chair, basically sad. We visit her every day because it was a short-term thing. We knew my mother would not be one that fell through a crack. That we knew. But unfortunately, we did not know that they shut the facility to the family members in the front door, and they took in COVID positive patients through the back door. And we were left with the ashes at the end and with a box and a name. So I am going to continue to fight, not just in New York, but in New Jersey, so that we can get the answers we need and that the families deserve, so that this doesn't happen again.
Are there any questions for the witness?
Yes, Senator, I have one. Vivian, thank you for being here, and thank you for telling your story. You talked in the beginning of your remarks about accountability and solutions, and that's what this is all about, and we're aiming for that. What if you could tell us 1 or 2 solutions you have in mind, or pieces of your accountability story? What would it be for us, and what should we be aiming for as a committee?
Number 1, the increase in staffing. I believe I heard that Governor Murphy tried to increase staffing, but we really have to look at the patient to nurse ratios, because I have I have 4 little kids. I can't even keep track of 4 kids. I cannot imagine a nurse watching over 20, 40 patients, especially at nighttime. You know, the other thing, this is a side note of my first point, is that how do you close down a facility in the middle of a pandemic and not have round the clock doctor care? In my mother's facility, the doctors come in a couple of hours and disappear. And we don't even know the authority that the nurses that are on staff while the doctors are away have in the event if a patient goes into some kind of distress or showing signs of needing more care that they are able to provide, and they don't have the authority to do decisions on their own. My second point is the infectious disease protocols and being prepared before any kind of pandemic. This is not just COVID. This is the flu or H1N1 or Zika. Anything that comes in these facilities needs to be addressed beforehand. And if there's insufficient fines, then we need to look at what offer cases get out of their penalties. So we need to look at what infectious disease protocols and what's lacking, and maybe set up a commission in each facility, as been proposed here in New York, to every 6 months, what needs to address. And I always argue that families should be part of any commission so that you can hear our voices.
They got 1, 2, 3, 4, about 10 speakers still to go, and they're
okay. No background noise. Can everybody mute themselves if they're not talking, please? Okay. Is Vivian still on?
I am here.
Okay,
I am one of the bunch of speakers. Yep, I'm here.
Okay. Now, when you're done, I would, if you could just tell us a little bit about your speakers, and I'll let you introduce each of the speakers that will be talking. Okay. And I would just ask the committee members because time to just hold off any questions that you have, and we can bring back individual committee members when their testimonies are done, because I believe there's 5 of them. Go ahead, Vivian.
Well, we have 5 members. So many more wanted to participate, but weren't able. So we're going to speak and do the best we can to just open the conversation in New Jersey and hear the stories of heartbreak of each and every member that was able to participate. And we hope that we'll have many more opportunities so that more members can come on to speak. I'm not sure in what order, but maybe if Linda Morella is available, maybe she can kick us off.
Hi, my name is Linda Morella. I live in Washington, New Jersey. I'm going to start by saying, I hope you don't mind, I don't read, and so that I can keep my thought process going. March 25th, 2020, St. Joseph's in Woodbridge outbreak. That started it off as far as I'm concerned. On March 31st, Governor Murphy sent out the directive that nursing homes cannot bar COVID patients. When I heard that from the social worker at the facility my mom was in, I was beside myself. But you're kind of like in a catch-22 situation. You can't take them out of there. You can't go see them. They're not totally understanding, or at least my mom didn't totally understand when I said to her, Mom, we can't come visit you because there's COVID virus. And she said, I have the virus. And I'm like, no, Mom, not you, but there is a virus and we don't want you to get it. So that's why we can't come and see you. Within days, Care One cleared out its Whippany location, sending the residents there to their Morristown, their Livingston, and their Parsippany locations. They started receiving the patients from St. Joseph's at the Care One in Whippany. What they didn't know, possibly they did, but then again, they weren't testing. One of the male residents, nearly 88 years old, from the Whippany location was transferred to the Care One at Morris in Parsippany, that he would be dead of COVID-like symptoms by April the 3rd. Just a matter of days after being transferred. I guess that's when the nightmare began. On April 2nd, my mom's roommate tested positive. My mom was moved into another room, but even though she had been in contact with someone who tested positive, she was moved into a room with another patient, which I totally did not understand. The 14-day countdown began. What we didn't know at the time is that the countdown would be never ending. By now, the cases at the facility, both for the residents and the staff, were out of control. I spent a lot of time there, and I got to know a lot of the staff, social worker, nurses, activities people, that I got to know them personally. So I can't say that I had a problem getting through to people and getting information regarding my mom. So I was fortunate in comparison to a lot of the other horror stories that I have heard, that people had no communication whatsoever. I cannot say that. On April 18th, my mom and her roommate were both running low-grade temperatures, and that's only because I was checking up on my mom several times a day, speaking to different people at the facility. And when I would check and find out what her temperature was, I knew my mom's normal temperature was like 96. Now they're telling me she's 99.8. Unfortunately, the staff that was, a lot of the people were new, they didn't know my mom's situation, or that she had been in a room with a person who tested positive for COVID. So it was like a never-ending struggle trying to update people. They kept a check on it, and they ended up moving her and the person that was in the room with her. They moved her to a COVID holding area. They both tested negative on April 21st. Her move back to the general population was short-lived. She tested positive for COVID on April 29th, suffered and died alone on May 7th. What I would like you to know about my mom, Eleanor: she was a fun-loving, healthy 98-year-old who had a wicked sense of humor. She was quite proud of herself, as she was one of the few at the facility that was not wheelchair bound. She walked 2 to 3 miles a day into her early 90s. Her older sister recently passed at 104. My mom easily would have made her 100th birthday next January, but because of Governor Murphy's directive and the greed and negligence of Corporate Care One, we will never celebrate that momentous occasion. I would like to say, add that the staff that took care of my mom in her final days did the very best that they could under the circumstances, and I appreciate everything they did for being her family when her family could not be there. Thank you.
Thank you. Vivian, who's next?
I want to know if Michelle Severino is available.
Unmute. Hi, my name is Michelle Savarino. My mom is Carol Biondi, who, unlike everyone else, I am blessed that my mom survived COVID in a nursing home. She's in a nursing home in West Orange, New Jersey, Alaris Health. She was in the hospital for a few weeks. She was in the COVID unit for a few weeks, but I am blessed to have her still with us. The reason why I have gotten involved with Voices for Seniors is, and again, Vivian, thank you for all you do for us, is just, when will it be our turn to get in to see our loved ones? We have, when talking to our facility and looking up all the guidelines on newjersey.gov, there is no, they tell you that we can go into the nursing homes, but the nursing homes have no indication as to when we can go in. There's no preparations being made. I have reached out to our nursing home to ask them what plans are being put into effect to get in, and they have no information for us, at least in my nursing home that my mom is in. My mom has been vaccinated. I have been vaccinated. I thought that was the end goal, is that we all get vaccinated and we can all be together again. But it seems like there's no indication that that is going to happen anytime soon. So I'm just here trying to get as much information as I can. I am blessed that I can have outdoor visits with my mom, though it's difficult in the snow and the 20-degree weather. Though we do it and we wrap her and get out there, I just was wondering if anyone had any indication that anything was going to move forward with that. That's all. Thank you.
Thank you, Michelle. Vivian?
Actually, real quick, just with Michelle, I don't want to belabor, but Michelle, does the nursing home report the percentage of residents that have been vaccinated? Yes, actually, I was told, and this was just last week, 80% of the residents have been vaccinated. Okay. And so though I don't have the staff amount that has been vaccinated, I'm going to assume most of them have been. And also they keep telling me that it depends on the regional rate of infection. Though the nursing home has 0 cases of COVID. It would seem to me that this would be a great line of questioning for the members of the press still here to the administration to say, where are the standards at this point? If you've got 80% of people vaccinated in a facility and people who are going to visit can demonstrate they've been vaccinated, we already should know standards and protocols, and the administration should dictate that those visits ought to be allowed, even if they're segregated somewhere for the visit. But I hear you loud and clear. This should be something that we all pay attention to and call on the administration to provide guidance on. Should have happened already. So thank you. Thank you.
Senator Panaccio, real quick.
Question, please, Senator. I want to get the group to all testify because the hour is getting late, and then you can make any comments or questions once they've all testified, please.
Sorry, Joe, for chiming in there. Apologize.
No problem. Okay, Vivian, who's next?
Heidi Weiss. Heidi Weiss.
Can you hear me?
Heidi, yes.
You can hear me?
I can hear you.
Okay. Thank you for allowing me to testify today. I'm Heidi Wise and my mother's Virginia Wise. I've lived in Mahwah for 25 years, Mahwah, New Jersey. She was in Fox Trail Memory Care in Ramsey, New Jersey. She's a COVID survivor, 88 years old. They did not remove her from the facility. They isolated her and gave her hydroxychloroquine early on in the course of the virus. She recovered. She was doing very well. They were going to send her to one of those Care One facilities that I've heard people speaking about, but they decided to quarantine her in her room. After they announced the second lockdown in November, I took her out and she's with me now. I don't know how much longer I have with my mother, and I didn't want her locked down again and to be talking to her through a window. So fortunately, my mother is a survivor of COVID, but I wanted to address something that Congresswoman Ramos said at one of the Voices for Seniors rallies, because I have some personal experience with that with my father. And she brought up the issue of seniors being given lethal cocktails. And I experienced with that with my father, who was given morphine Ativan when he was not in pain, not suffering, and certainly not dying. I reported this to the Department of Public Health. They investigated. The facility was shut down. But I also reported it to the state police, the prosecutor's office, and the way that we have been treated, many of us who have similar stories, has been disgraceful, the way we've been treated by our public officials. No one would investigate other than the Department of Public Health. They would not investigate it on a criminal level, which I believe what's going on is. And it's the first time when Congresswoman Ramos said this at the press conference for Voices for Seniors that I have ever heard it even broached by anyone in the legislature, the media, anyone. And my heart is forever broken about what happened to my father, who is a veteran, a man who took care of his family, a Little League coach. He certainly didn't deserve this. And the families are being tricked. We were tricked to believe that he was dying when he was not. Healthcare proxies were fraudulently invoked. There's so many nefarious things going on, and I'm happy to speak to any of you privately. I have all of my father's records, and I've studied them extensively, as no one else would, because he's my father. So I'm happy to answer any questions that you may have about that, but I have a big concern that this may also be going on with COVID, since Congresswoman, Ramos raised the issue at the rally, and it's very disturbing. And the many people, Marsha Joyner has a blog radio show every week with people telling these chilling stories. They are deeply affected by this. And I have very grave concerns that it's also, it's continuing to go on with COVID. It's going on across the country. And Peter Wawrinski from the Washington Post did do a series of articles about it about 7 years ago. It was excellent. He's an excellent journalist. I spoke with him about it and what happened to my father. And he said, sadly, he believes that it's still going on. And it is. And thank you for listening to me, because the way that I've been treated, as I said, by the state police, the prosecutor's office, the governor's office, I've been hung up on, screamed at, had my credibility attacked, all because I'm trying to bring this to people's attention, not just myself, but many others, and we are being ignored. And I want to thank you for hearing me today.
Thank you, Mrs. Weiss.
If I may address really fast, the reality is that what COVID did is expose the horror stories that happen, not just of COVID. And I think that that's, if there's anything positive, which, it's really hard to say, we can see that this is, there's a lot of things going on that really need to be addressed. So I wanted to know if,
Vivian, could I just say one thing? To this day, no one can give me an answer as to why my father was being administered these drugs when he was not in pain, not suffering, and not dying. No one, even the Department of Health, will answer that question for me. And I believe I deserve an answer to that question.
Yeah, Elena, thank you. Wanted to know if Rima was available. I don't want to slaughter her last name. Seema? Saman?
Hi, my name is Rima. Can you hear me? Hi, okay, perfect. So my name is Rima Saman, and my story is a little bit different than everybody else's here. My brother, Rami Saman, died in a nursing home at only 40 years old. He was sent there by a hospital. He was released. We were told he could come home. He was getting better. He had been battling for about 3.5 weeks. He was getting dialysis, and he was improving. And we got a call saying he was getting better and he was going to be coming home. And then within about maybe 12 to 16 hours later, we got a call saying that he could not come home, that he had to be released to this nursing home, and he had to be quarantined there for 14 days before he could come home to us. When we asked why that was, they told us it was because the nurses that were attending to my brother had tested positive for COVID. And in order to ensure that Rami was not positive, he had to be quarantined for 14 days. And this is where he would be sent. They would ensure that he would continue his dialysis on Mondays, Wednesdays, and Fridays. And we had nothing to be worried about. My brother died within 48 hours of reaching that facility. He got there about 6 p.m. on Friday, May 8th. And we had spoken to the doctor that was administering the dialysis. He was doing great. We had spoken to him as well. He was in high spirits. He was very coherent. He knew exactly what was going on, was excited about the idea of coming home. On Saturday morning, he called again. He complained about the environment. He said it was very messy, very dirty, couldn't find his own stuff. He was having a hard time finding his charger to his phone. When I addressed this with one of the aides there, they told me that my brother was making it up, that maybe he was a little, delusional from the medications, didn't really know what was going on, and that I had nothing to be concerned about. On Sunday, May 10th, my brother again was in good spirits, called about 9:30 a.m., very coherent, called me by my nickname, called my mother, wished her a happy Mother's Day, and called his girlfriend and spoke to her as well around 3 o'clock in the afternoon. At 5:30 p.m., we got a call from one of the aides there stating that my brother had fallen and hit his head and passed out, but he was okay. So his girlfriend, out of concern, asked to speak to him. When she got him on the phone, she noticed he was slurring his words. So she immediately said, "He doesn't sound like himself. Please get him seen by a doctor immediately. He's slurring words. He doesn't sound like he's okay." They said that they had a doctor doing rounds and that my brother would be seen by the doctor very shortly. At around 9:07 p.m., we got a call stating that my brother was found in bed, non-responsive, and had passed away. Now, this is where it gets very tricky for me, and this is why I'm here and speaking about this. After that, we were told that now we can finally go to this nursing home and see my brother's dead body, instead of when he was alive, we couldn't see him at all. And obviously, I had to make funeral arrangements. We got there around 1 a.m. in the morning. When I got there, I was escorted in by a lady that worked there and a gentleman. And right away, they let me know that I was on the non-COVID side and we were now entering the COVID side. Masks were required. My brother, the entire time there, had never been provided a mask at all for protection. When I get into my brother's room, he's completely naked on a bed with a sheet covering him. And of course, my mother being distraught, I get her a chair. After we finally, the tears come down and everybody's calmed down, now I'm trying to get everything together. I can't find my brother's belongings. So I leave the room asking the aide where my brother's room was, because this particular room looked like a storage space. It had about 50 to 60 bags of other people's belongings in that room. The clear bags that you get from the hospital where they write your name and your belongings are in there. There were about 50 to 60 of them in there. There was markers and pens and crayons all over the floor, as though kids had been playing in that room during the day. So I left the room. I said, "Hi, I just want to get my brother's belongings. Do you know where they are?" She says, "Oh, that's your brother's room." So I was floored that this room is where my brother was staying at these last 48 hours. And then on top of that, to this day, I have never retrieved my brother's belongings. My brother died on May 10th of 2020. It's almost a year now, and I can't get his clothes. I couldn't get his charger, and I couldn't get any answers from anybody. So then I get my brother transferred to a funeral home, and obviously we're trying to make funeral arrangements, and they were very kind to us. The owner of the funeral home calls me about 72 hours later and tells me that he doesn't want to concern me, but in the state of New Jersey, a death certificate needs to be issued within 24 hours of somebody's passing, and that he has not received a death certificate from my brother. He cannot get a call back from anybody at the nursing home, and he's even been generous enough to give him an extra 48 hours to get this death certificate, and still no reply. Obviously, I don't know what to do, so he tells me that I have to call the police and run an investigation. So I called the police, and a nice police officer started running an investigation for me. Long and behold, less than 24 hours after he starts the investigation, a death certificate is issued. And this is why I'm here to speak about this today. That death certificate is issued by their medical director, who was not present that evening when my brother died. I don't understand how somebody can sign a death certificate without being present. The death certificate states that my brother died of natural causes at 40 years old. 40 years old, natural causes. That is unacceptable. Then when I call the doctors and let them know, the doctors that were attending to my brother, as far as his dialysis goes, they were floored and shocked. They could not have They didn't understand how that was possible. Then when I called the hospital to explain to them, I insisted on speaking to the doctor that released my brother to this nursing home. When I spoke to her, she was very apologetic. She was extremely shocked and explains to me that she is just a resident at the hospital and is following hospital directions as far as where to release the patients to, that she doesn't even know where this nursing home is and that she has never been there. So today I'm here because I need justice. I'm part of many victims. I know that we are talking about seniors and we are talking about, the nursing homes, but the reality is seniors are not the only ones that are passing away in these nursing homes. I know we mentioned that there are more than 8,000 deaths in the state of New Jersey. My thing to you is how many of those deaths that are not coded to COVID are a cause of this? My brother should have never been there. My brother should be here to speak to everybody today. My brother at 40 years old, who was very healthy, who gave back to the community, who has raised funds to help the homeless, to help churches maintain themselves, and has dedicated his life to giving things to others. And this is the way he died, naked, in a nursing home, alone. He should have been attended to for that fall. That law that was created that gave these nursing homes coverage, that my brother should have had proper care that evening. He should have been seen by a professional doctor. Who's to say his death was COVID? Who's to say his death was a brain aneurysm? I will never know those things. And also because of COVID, nobody wants to do an autopsy. And technically, even though my brother was not tested and put into this home, he was put into the COVID zone when he was very, very vulnerable. Somebody spoke about it, one of the centers in the beginning of this call, about putting most vulnerable patients in these types of environments. Somebody who's on dialysis, who just got over cardiac arrest and dialysis and fighting for his life, is put into this nursing home in the COVID zone, which, by the way, when I walked through at 1 a.m. in the morning, okay, there were old people on beds, carts of beds in the hallways, no masks. They had no rooms, almost on top of each other. The beds weren't even 6 feet apart and wrapped around in plastic. And again, like I said, my brother, I thought he was placed in that room because he passed away and he was meant to be kept separate. But apparently that's his room the entire time. And when he called on Saturday to complain, I got the verbiage that his room is, he's delusional right now because of medications. I have nothing to worry about. To top that off, the male attending nurse that evening that escorted us there, when he called us that evening, so I called the medical director several times requesting to speak with her. I've never gotten a call to this day. I get the manager of the facility calling me on a 3-way call, and at first she claimed there was no male aide. And then when I proved to her that I had records of the call, through my call log, all of a sudden there was a male aide and that he had to be spoken to, and I'll get a call back, and I've never gotten a call back. I've never gotten a chance to get my brother's records to this day. And again, like I said, I've never gotten a call back from the medical director. I did report this facility to the Board of Health, and I got a call back that there was an inspection done 4 days prior to my brother's death, and they found nothing wrong with the facility. How is that possible? I physically saw the environment for myself. I know what I saw. My brother deserved better, and every single one of these 8,000 lives that have died in these homes deserve better. So I'm sorry if I sound angry, but I'm begging you. I am begging you. Please don't let this call fall on deaf ears. Please help us. Help me. Help my mother. Help everybody, because it's not fair. We don't have any closure. We need answers. I want to know why my brother was there. I want to know why he was sent there. And I want to know why he didn't deserve proper treatment. We treat animals better than the way my brother was treated those last 48 hours. Why can't I get his belongings? Those are things that are sentiment to me. I can't even get a call back. So I'm asking you, I don't know if this is part of the business plan that was intended to release these people to these nursing homes. I don't know why masks were not required of them while they're in there when we, in public places, whether we're taking a walk on the beach or in the park, we're required to wear masks. There's clearly a lot of neglect and a lot of things that went wrong here, and somebody needs to be held accountable.
And we're going to try to do that. Thank you. We're going to try to do that. Thank you very much for your testimony, and we're awfully sorry for your loss. Please stay on because there may be questions for you once the group is done. Thank you.
Thank you.
Vivian, you have one more, you said?
Yeah, one more. Elena Stabile, I think.
Yep. Thank you, Vivian. I want to thank you, Senator Panaccio, and the committee members.
Okay.
And without Vivian, we wouldn't be here today with all the hard work she's done for us to tell our stories. And I'll try to keep the comments brief so the others have a chance to speak. I don't blame the Trump administration. I blame the 5 Democratic governors who mismanaged the COVID crisis in their states and in these nursing homes. This is my grandmother. My grandmother, Angelina Marinaro, lost her life at the Complete Care at Shore Rock Gardens Nursing Home in Brick, New Jersey on April 10th, 2020. They had admitted a sick COVID patient released from the hospital into this nursing home the week prior. My grandmother tested positive on Wednesday, April 8th, 2020, and she was found unresponsive at 5:40 p.m. on April 10th. That was a Friday. My mother did a FaceTime call with my grandmother on that Wednesday where she was communicating through a staff member, and she wasn't complaining at all of being sick at the time, although she was running 101-degree temperature at that time. The nursing home had isolated my grandmother on that Wednesday. Once the positive test result came back, we don't know if she was alone in a room or with other sick COVID patients. We heard nothing further from the nursing home the following day, which was Thursday, and had only heard from them when she had already passed away Friday evening. Later on, when I reviewed her medical records, I saw that on that Friday, the 10th, she passed away. The last physical check-in on my grandmother was at 10 a.m. She was found dead at 5:40 p.m. Almost an entire 8-hour shift went by where not one staff member checked on her. As we now know, 5 out of 50 governors put these deadly policies in place, exposing our most vulnerable citizens and basically signing their death warrants, forcing sick COVID patients into nursing homes. We know that over 40% of the total deaths in the United States came from nursing homes. These 5 Democratic governors shut down their states. They forced small businesses to close. They forced many onto unemployment that lost their jobs and murdered thousands of our innocent people, our loved ones, in the process. Not only that, they locked down nursing homes where families had moved and forbidden, as you heard with some of the stories, from seeing their loved ones, which in turn created a new travesty, the death by loneliness and isolation of our loved ones in these care homes. Not only did Governor Murphy sign an executive order first forcing these sick COVID patients into homes, he and the other beauty, Judith Persicelli, protected these nursing homes by changing the definition of negligence, making it almost impossible for lawsuits to ensue, where we could hold these nursing homes accountable for the death of our loved ones. This has made having closure nearly impossible. And the mere fact thinking this corrupt governor will get a pass for this crime is something that the people of this state should never allow to happen. And I hope he's listening to this call today. I was going to the state dashboard as a resource in the months following my grandmother's death, watching the COVID death counts increase in the weeks and months that followed, only to find out in July of 2020, big shocker, the state officials took down the dashboard's total numbers at each nursing home and instead started reporting only deaths in cases as they occurred in an active outbreak. Judith Persicelli explained this very misleading change as providing a quote unquote clearer real-time picture of what is going on, end quote. Transparency on providing the entire picture, both historical and current, should be readily available to everyone at any time. The state blatantly decided to hide and withhold this information. In the state of New Jersey, hiding the total number of nursing home deaths in New Jersey, as did Andrew Cuomo in New York, committing a federal crime. Are they in fact withholding the nursing home total death counts in this state, as did Andrew Cuomo? That's yet to be determined. As of January 4th, 2021, we know COVID in New Jersey long-term care facilities and cases and deaths have doubled over the past 45 days. But according to Governor Murphy, he would rather vaccinate prisoners before nursing home residents. Criminals come first for this governor, and he needs to be held accountable for his alleged criminality. And this governor needs to be investigated for his actions. Republicans in Pennsylvania are in fact calling for an investigation of Governor Tom Wolf into the handling of the COVID crisis in nursing homes and unconstitutional state lockdowns. As we see Governor Whitmer, the dominoes are starting to roll now. Governor Whitmer of Michigan, also in the process of potential impeachment. Governor Newsom of California, the people of his state have signed the numbers of a recall. So he may be recalled there. And Cuomo, as we know, under federal investigation for his withholding of the nursing home deaths in his state of New York. Since Governor Murphy touts his strategy and proudly speaks of how he followed Cuomo's model, we now know Cuomo's model killed over 13,000 elderly victims that we know of, and wasn't the correct model to follow by any means. We need to make sure an investigation is launched into Governor Murphy's mismanagement and poor decisions that killed thousands of elderly people. Thank you all. I appreciate your time listening to my comments today.
Thank you, Mr. Stabile. I understand that Senator Oro, you have a number of questions that you'd like to ask. Please, you're up.
Actually, Senator Panaccio, and actually some of the, and thank you very much for all the testimony that we've heard from all the witnesses, and some of the common themes that we've heard is, can we find out if we know, we need the accountability, and we all know on this call, the number one responsibility of legislators, we all hear about the laws that happen and things that happen down in Trenton or different state capitals, but the number one responsibility we have is constituent service. And I just want to bring up the fact that we're now in a year where the executive orders have basically determined what's happened in the state. And I just want everyone, all the witnesses, to know that we've been pushing for a constitutional amendment. And what that does is allows the people to vote. And if we get 3/5 of the legislature, 3/5 of the Senate, 3/5 of the Assembly, both Republican and Democrat, to allow you to vote, we have a constitutional amendment that says no governor, irrespective of party, should be able to do an executive, executive order or emergency order for more than 14 days. Now, we would gladly agree to 30 days or something, because there are situations where you need that kind of power. Like Superstorm Sandy, 9/11 occurred. So there are certain those areas that those emergency orders need to be put in place. However, we have done, at least Senator Panaccio, Senator Testa, myself, the senators on a call and the Assembly members have supported and also stood in the legislature asking for this constitutional amendment to be brought to the floor and voted on, to give you the right to say that these executive orders shouldn't be, a year. They should be a reasonable amount of time, and that the governor, any governor of any party, should have to come before the legislature and at least discuss some of the things. And therefore, when we're hearing from constituents like yourselves, it would give us the leverage to say to the governor, hey, what about this? How about, how can a plan for this? We're hearing the complaints about whatever it happens to be, because let's face it, lots of things have happened during this whole year. So I just ask on this call, I don't have a specific, question, Senator. My answer is, first of all, thank you very much for your very emotional and very heart-wrenching, testimony. But the reporters that are listening, the constituents that are listening, it's very simple. Let's put that constitutional amendment on the ballot, give you the right to tell a governor of any party that it can't just be one individual running the state for this period of time. And therefore, and as I said, the most important responsibility we have is constituent services, and that's for you. And if you're given the right to vote on it, we could certainly help a lot more. So thank you very much, and thank you, Chairman.
Any other members?
No, thank you.
Okay.
I appeal to the
I'm sorry.
I do appeal to the media. I do appeal to the media. Without you, we cannot tell our stories, and without you, we cannot get down to the bottom of this. So I appeal to you personally.
Okay, I just have I have a couple of follow-ups. It was hard because somebody wasn't on the screen, so I apologize.
Sure.
Sometimes
okay.
if you listen, the people that you don't expect to say the most say an awful lot, and I was listening to this testimony, and they just reinforce a lot of the things that people at a very higher pay grade, quite frankly, have been saying that's different. For instance, Linda Morella was told by social workers that patients could not be called. So obviously that edict trickled down from Trenton to the social worker. And I guess it would probably surprise or not surprise her as the governor being quoted now. He said that reports that nursing homes were forced to so unfortunately, for some of these people and their loved ones, it was not a myth. I was listening to Rima. Rima said that the brother was admitted with no testing. So we don't know if he had COVID when he went to the nursing home. We don't know if somebody gave it to him. But part of that issue was the edict itself that the Department of Health, Rima, promulgated on March 31st. Besides saying that those patients could not be denied, went on to say that they cannot be tested also. So against CMS and CDC guidelines, how could you isolate and quarantine somebody if you cannot test them? There is a question about, and I know this group here has sort of a New York, New Jersey blend in it, and quite frankly, it should. Because we, as New Jersey, mirrored almost to a T what New York did. So it's hard to, New York right now is being chastised, the governor is being chastised, which I think he should be for a number of things. But it's sort of interesting to see that although we mirrored everything, so far the attention has been harped on strictly New York. And yet because we carried New York to a T and our edicts were verbatim, it just shocks me that why we're not holding and asking all of us, the legislature, both sides, the media, why we're not probing what the results were. And could anybody doubt that the results, being that we were following the leader, quite frankly, we're no different than New York. On March 16th, the edict started going out even before they started copying those edicts. And the governor of New Jersey was saying, again, you are known by the company that you keep. He was speaking about that. I couldn't be in better company than Governor Andrew Cuomo and Governor Vermont. They decided that they want to take a regional approach to the handling of COVID. Well, I think the Justice Department sort of figured that one out too, because in August, there was a story that said the Justice Department was considering whether Cuomo COVID nursing home policies killed thousands. And the reason that the Justice Department is considering it is because some of the obfuscation that went on in both administrations when it came to nursing home policies, that quite frankly, they just weren't, and we found this out with the whistleblower in New York, they just weren't being honest and upfront, and getting those honest and upfront of how people died and where they died, to Rima's point, I think is very, very important. Percy Kelly said that she ordered operators of the facilities not to accept COVID patients unless returnees could be isolated from uninfected residents. They could provide enough staff and PPEs. What she left out was you can't test them. You cannot isolate some. Why would you isolate somebody that has COVID with somebody that doesn't have COVID? The only reason you could and you should would be that you know the difference. And certainly you wouldn't want to spread that virus in. So I think hopefully with time and maybe perhaps with this committee's questioning that we have and with the testimony that we have, perhaps going forward, maybe we can start getting some of those answers. We're doing as best we can, but keep in mind, say partisan committee, not because we didn't try, but that partisan committee also lacks subpoena power. So many issues that need to be answered, that the group that all the witnesses are screaming for. Won't get those answers. God knows we've been trying for a year now, and we still haven't gotten answers. The same answer we get from the administration every time you do an Oprah request is that it would divert attention from the important work that whatever the Department of Health is doing. So thank you all for your testimony. Are there any follow-up questions before we let the witnesses know? Thank you very much. Next up is Ginger Vukas.
Hi, my name is Ginger Vukas, and I live in Randolph, New Jersey, in Morris County. I have an 84-year-old mother who has dementia, who lives in a healthcare memory care home in Warren County. And I am, first of all, I want to thank the Senator Panaccio and the committee for allowing us to all have our time today to share our experiences with caregiving and the impact of COVID. I truly am humbled by the stories that have been shared here today because while for my life, my situation has been very difficult, it really pales in comparison with those who have had such tragic losses. My mom came to live with me for a year, and as her dementia and cognitive skills increased, it became apparent that I was unable to care for her by myself. She was unwilling to have a caregiver come in, plus it was COVID time, and we were not willing to have someone come in, particularly if it wasn't the same person all the time. I finally had her go to a memory care home and I never ever got to see the facility inside. All I was able to do was look online, and they had a great video. And so part of the challenge was feeling comfortable where your mother was, even though you didn't really see what her room was. And I was not able to go in and help her get settled, which, as you can imagine, for a dementia patient was a very difficult transition. Well, my mom's been there for several months now. The good news is my mother wasn't healthy. And because she wasn't healthy and had a breast cancer scare and fell and broke her leg, all of which are not good things, but it allowed me to accompany her to the ER several times, to go to her doctor appointments, to go to her mammograms and such. So I was able to actually see her and touch her and hold her and kiss her and bring her treats from home and things like that. For the last several months, she's been healthy, and all those health issues have been resolved. And now she's suffering for what I think is the greatest problem associated with COVID, and that's the isolation of our loved ones in the long-term care communities, regardless of how old they are. In my mom's case, I've seen her cognitive abilities decline in just the few months since she's physically seeing me. She's unable to use technology, so FaceTime doesn't work. Her bed's not by the window, so making a window visit is very difficult, and it's too cold for her to go outside right now. So I wait for the weather. I wait for the snow to melt so I can go back and at least look at her. I drive 40 minutes, sit in the parking lot, talk to her, get out of the car, come knock on the window and wave to her. And that's all I'm able to do right now. So in terms of what I think needs to be done, I think one of the most important things that people have to realize is that family is essential. And our loved ones need family. They need family to come in back into the care facilities and provide the emotional and physical support that our loved ones need. A lot of times when people use the terminology visitation, they think it just means, oh, you're going in with a box of candy and something like that. No, people are going in to be needed caregivers, which in turn makes the care of these residents easier because the staff at these residents have less, they have less things that they have to do because people are helping. So I think we also have to realize that isolation is really killing people. Because of the isolation, there's weight loss, there's depression. My mom thinks she's living in St. Louis with my sister, which she hasn't done for several years. There's confusion, and it's all augmented for someone who's a dementia patient. There's weight loss. And ultimately there can be failure to thrive, which is the technical term and probably the death certificate term for people who pass away from isolation. And it's sad enough that people are dying of isolation, but they're dying in isolation where their family members cannot even get in to help them. So there's other aspects of caregiving that are probably broader. When I first received the invitation to talk here today, I thought of other things that the state of New Jersey can do to help, and that is to provide more resources to find the right home for loved ones. There's no centralized resource on a New Jersey State page or Department of Health page, or at least if there was one, I didn't find it helpful. It took me 4 months, but I'm happy that I found a wonderful home for my mom. We need to have an easier process for people to apply for food stamps and Medicaid as needed. And I'm fortunate that I was able to contact the Alzheimer's New Jersey programs, and I'm still in a support group, and the support groups have been fabulously helpful. And they also gave me a 1 week respite scholarship so that I could take a week off, and my mom would be cared for, and my husband and I could recoup and get our energy back, because unless you've been a caregiver yourself, it's almost unbelievable to imagine how hard it is. And even now, when my mother's in a care facility, I'm still tethered to my cell phone 24/7, always have to be available in case the call comes that said she fell again, or she's sick, or she's in the ER, and I have to respond immediately. So if I have any one last passing thought, is the fact that I really believe, and I believe that this group of legislative people can make this happen, but there has to be a way to get the New Jersey Department of Health to develop now a new vaccine, let's call it vaccine or post-vaccine visitation directive that's clear, that's concise, that's enforceable, and it's done everywhere. And we can't wait any longer for everyone to get vaccinated. I'm vaccinated, my mother's vaccinated, 85% of the staff is vaccinated where my mom is, almost all her residents are, and I still cannot go in there. And I'm a chemist by training, my daughter's a biologist. We don't get it, we don't understand it. So that's my takeaway, that's my ask. We need to work now to end the isolation of our loved ones in the long-term care communities and get that post-vaccine visitation directive implemented as soon as possible. So I thank you very much for listening, and I wish everybody the best.
We're going to hear from Kenneth Zent because she's testifying along with Ginger, and he's the CEO of Alzheimer's New Jersey. So if you have any questions, we can ask them both as a group once Mr. Zent is done testifying. And I hope I didn't butcher your name, Mr. Zent. And I hope you're there.
I'm here. Thank you. No, as Zent, but that was pretty close. So I'm just, I'm the president and CEO of Alzheimer's New Jersey. We're a local New Jersey incorporated independent nonprofit organization serving the needs of 600,000 New Jersey residents that are impacted by Alzheimer's disease. So I'm going to talk pretty specifically about the nursing home situation with people that are, that have dementia. And of course, Ginger nicely mentioned some of our programs. So we've been trying to do what we can to support families who are in the situation where their loved ones are in nursing homes, and some of them haven't been able to visit for a year. According to a poll that we did conducted by Fairleigh Dickinson University, 68% of New Jersey residents know someone who has or had Alzheimer's disease or another form of dementia. As you may know, it's a progressive neurological disease of the brain. Not only does it destroy memory and thinking skills, but eventually those who have the disease lose the ability for everyday tasks like dressing, eating, and it's also the 6th leading cause of death in our state. Most of the care is provided by families at home at huge personal, physical, emotional, and financial costs. As a matter of fact, it's estimated that in New Jersey, family caregivers last year provided 658 million hours of unpaid care at a dollar value of over 12 billion, which is a huge savings for our formal healthcare system. So, as I mentioned, as the disease progresses, caregivers take on more and more and more responsibility. At some point during the disease progression, many families make a very difficult decision to transition care from home to a long-term care residence. The CDC actually estimates that about 50% of nursing home residents have Alzheimer's disease or another form of dementia. So that's why this is so important. Because of the cognitive deficits and the confusion experienced by residents with dementia, their care for staff is more intense and more complex than care of residents without dementia. So with the realities of staff shortages that a few of the witnesses talked about today, and other stretched resources, staff in residential care facilities depend on family caregivers to fill in the gaps. Within residential care facilities, family caregivers, as Ginger mentioned, are really essential partners to quality care. Families do much of the feeding and bathing. They advocate and communicate for their loved ones who unfortunately live in a world that has become very confusing. Residential care visitation policies during the COVID crisis need to recognize and accommodate the unique needs of those with Alzheimer's disease. Dr. Jason Karlowich, who has been in the paper a lot, he's the co-director of the Penn Memory Center at University of Pennsylvania. What he said is the blanket ban on family caregivers in our long-term care residences is like taking away a wheelchair from someone with a physical disability. Even the Centers for Medicare and Medicaid Services in September issued new guidelines for nursing home visitation during COVID-19 that recommends a person-centered approach to visitation to meet the physical and psychosocial needs of each individual resident. The 2016 New Jersey Alzheimer's Disease Study Commission report that was submitted to the legislature a number of years ago highlights the importance of person-centered dementia care practices in our nursing home. But instead, what we have currently is what Jill Harrison, an executive director with the National Institutes of Aging's Impact Collaboratory, describes as prioritizing physical safety above all other considerations. The current visitation policies for residential care facilities have made some important exceptions to strict visitation limits. So there are definitions of essential and compassionate caregivers in those directives. But what we're finding is that, and much of this comes from the feedback of people in our support groups, people on our helpline, the caregivers that we work with on a daily basis who have loved ones in long-term care, is that in practice, those designations of essential and compassionate caregiver are being applied without any oversight and enforcement and left up to the interpretation of each individual long-term care facility. So caregivers who should qualify for this type of visitation are being denied. And for those who do qualify, their ability to visit from one facility to another is completely arbitrary. I think that every caregiver of an individual with dementia should be able to qualify as both an essential and compassionate caregiver, and that's just not happening. Over the past year, we've obviously learned a lot from science and medicine about the coronavirus and its health impact. But as we've learned more, the long-term care the visitation policies haven't changed. The same policies that enable staff to safely work in our long-term care facilities should enable designated family caregivers to visit safely indoors. We can protect residents from the spread of the virus, and we can enable safe visitation at the same time, particularly for the needs of those residents with dementia and the services that family members bring to those residents that are so important to quality care. Alzheimer's disease is a terminal illness. Making families feel as though they have abandoned their loved ones in the last stage of life can't be good policy. At a time when their loved ones are the most vulnerable, family caregivers need recognition of their essential role in providing quality care, along with the ability to bring comfort and love to a parent, a spouse, a partner, or a grandparent. Sometimes that's really all they ask. So I thank you in advance for your leadership. I thank you for the opportunity to testify at this hearing. We need to do better. Families should be able, two things I believe can exist at the same time. We can protect residents from the spread of COVID, and we can allow families to safely visit. I don't think those things should exist in isolation. They can exist together.
Thank you, Mrs. Zanth. Are there any questions for either Mrs. Vukas or Mrs. Zanth? Well, I just want to share with you one thing, because somebody had shared this with me. It was a letter from a nursing home, and this is dated February 24th. And it says, following all CDC state and local guidelines that are announced, we have in place a stringent screening measure to mitigate spread of the virus and protect the health and safety of our workforce and residents. Goes on to say, unfortunately, following state mandate, we must suspend visitation at this time. Yet, this is dated the 24th. We have a news article from The Hill dated on the 11th, which says fully vaccinated people don't need to quarantine after COVID exposure. CDC article dated a few days before that said that the CDC says that people who have been vaccinated are no longer required to quarantine after exposure to someone with coronavirus, so long as they've received both doses of the vaccine and at least 2 weeks have passed since their shot. That seems like we're applying a little bit of science. That's what makes a mother able to care for her child who had chickenpox or measles, because we have vaccines and most of that is eradicated, because that mom had the immunity, in some cases, the vaccine. So initially the vaccine was given to elderly, frail, in nursing homes, correct, Mrs. Zenith?
Yeah, that's correct. Yeah, that is correct.
Again, even considering that science, and I'm a retired dentist by profession, the science I was taught is even if they've gotten the vaccine and the vaccine is effective, and you walk in with COVID, they can't get it. You don't walk in with COVID, they're not going to get it. So I think these rules that they're promulgating, and they're going back, this is blaming the state. And yet the CDC has its own edicts that are already out, it's already touched upon. So I think hopefully maybe the State Department of Health, when they can find some time from their very busy schedule, from giving press conferences, I would hope they would look at this, because my sense is that you're going to have more people affected, becoming ill and dying from some of these rules and some of these isolations now after 1 year than the actual COVID virus itself. So again, are there any other follow-ups by any of the members? Thank you very, very much. With that, we are about to conclude the testimony that we took today. I have a closing statement, but first I'd be remiss if I did not thank all of the participants in today, especially reaching out to those people that did lose loved ones in nursing homes, and in some cases, people that are still in nursing homes as we speak. I would like to once again challenge the Democrat majority to work with us and cooperate on a bipartisan fashion. During previous administration, Republicans and Democrats did work together. We formed an investigative committee with subpoena powers and probed into the Bridgegate affair. Don't we owe the families and loved ones of New Jersey's 10,000 dead souls answers? Such a committee with subpoena powers could extract the answers that this committee is unable to. Instead of the administrative denials, questions such as the following could get answered. Explain the close working relationships between New York and New Jersey. Why does it seem New Jersey played follow the leader? Administration officials in New York claim to have downplayed the actual nursing home deaths because of fear of political repercussions. Did New Jersey? Was it ever discussed between governors of New York and New Jersey and their staff about potential political repercussions? Were there any discussions about forcing COVID patients into nursing homes, prohibited testings? Could the administration supply the minutes to that meeting? Who attended? I'm very curious to see if the state epidemiologist ever chimed into something like that, some of that voodoo science that was promulgated by the state. Why were the staffing levels of the various health departments and agencies reduced? Were they ever brought up to proper levels before the reduction? Did it affect the way we handled the pandemic? According to the whistleblower, were there ever 1 million N95 masks discarded? Why? Were they replaced as they were being discarded and thrown away? Did they speak to the CDC first, who advised against that? Was there a consideration given to utilizing the USS Comfort, the Javits Center, and the field hospitals prior to sending them away? Did the state ask for their PPEs, their staff? What is the real count of nursing home deaths, including staff and nursing home patients who died in hospitals? As the state epidemiologist testified, make him testify as to his input. This is the main infection specialist in the state of New Jersey, how infections are spread. What was his input? Did he write that directive to force those COVID patients into that nursing home to prevent testing? I can't see a man of science having done that. And if he objected, I'd like to know if he did so, and quite frankly, who overrode him. Why, according to the Justice Department, was there a lack of cooperation of New York and New Jersey to an earlier probe that necessitated a Justice Department investigation, ongoing investigation? So there are numerous other unanswered questions, not because this committee has not been diligent in trying to find out, but rather because of the deafening silence of this administration. So thank you all for participating. To our viewers, thank you for listening, and trust us, at least the members on this committee are listening to you. Stay safe. God bless you all.
Thank you. Senator Penacho, may I make a comment, please?
Sure.
Thank you, and thank you, Chairman, very much for pulling this together. And listen, we've been, it's now just come up about 4 hours. Unfortunately, it should have been many months of this kind of investigation. And I'm just hoping that this, and I really appreciate very much everybody who came and gave us testimony and their stories and asking us to do something. And quite frankly, it's so frustrating for us that you know, unfortunately, a lot of times we don't have even the information that is, you know, we don't have the information in our hands either. And we're trying to do things for our constituents. But thank you so much for everything you've given. I'm hoping that these 4 hours turn into 100 times this amount of time, taking a look in to see what we can really do. Because if you think about it, you know, I find it ironic that we didn't have better protocols in place as to how to do these things after Dr. Smith talked about so many things that we have done and handled in the pandemics. And at the same time, be so proud of the fact that within a year's time, we've gone from, you know, detection to testing to research to a vaccine to production. And if we can do all that, and thank God for all the smart people out there that are doing this, because if we can do that, then I have to believe that at the beginning of this, we would have had different protocols in place as to know how to minimize the suffering that occurred. So I want to thank everybody very much for their testimony. It is extremely, extremely important that you were here. You were heard, and I certainly hope the media and everybody else that might be listening, the administration might be listening, and the majority party might be listening, that these 4 hours lead to many more discussions like this and action. Thank you.
Senator Crowder, did you want to say something?
Yeah, I just wanted to thank all the witnesses for their heartfelt testimony. It's not easy to get up and tell your story, but you all advocated for your loved ones and you advocated really well. We truly appreciate you taking the time to spend with us today. We heard you. There's a lot of information, and we hope moving forward this will lead to, you know, as my colleagues just said, you know, independent bipartisan hearings. We can get to the bottom of things and we can move forward and do things better in the state of New Jersey. We owe the 8,000 victims that and their families that much. And so on behalf of all of us, I would just like to let you know how much we appreciate your testimony. You guys were wonderful.
Senator Scanlon, did you want to say something before we chime off?
Again, just thanking everybody. It was really informative and moving and touching. Gutsy thing everybody did today. Hopefully it's just the first step. Thanks, Senator, for sharing.
Any other members, any other discussion? Well,
Senator, if I may, I just want to thank you for the hearing and inviting the Assembly members as well. I'm more convinced than ever that we need a bipartisan committee with subpoena power. So once and for all, we can hear from the Commissioner of Health under oath about her directive and why she issued it. And we also need to test the veracity of those in the department who are telling us what the numbers are, the numbers of deaths are, because we've seen in New York that what you're told is not always accurate. So we need those witnesses to come before the legislature so we can test what they're telling us and we can find out if it's accurate and truthful. So thank you.
Anybody else? Well, I will leave you with this. A reporter recently asked me what we hope to accomplish from these hearings. What was I looking to get out of it? And I told them the truth. Thank you very much. I think
Senator Testa and some of the Crows have something, Chairman.
I had asked, but nobody had. Who's up? Senator Testa? Senator?
Yes, thank you, Senator.
Go ahead.
Senator Panaccio, I just wanted to say thank you for having the idea of forming this committee. Obviously, I think this is an extremely important committee that is just the first step in getting to, in our search, our quest for the truth here. I want to thank each and every one of the participants who testified. As Senator O'Scanlan said, that was gutsy. Many of us were moved by the testimony. And unfortunately, it only served to shore up our beliefs that what we already knew, that the COVID-19 era was handled horribly by the Murphy administration, especially when it came to our long-term care facilities, our veterans' homes, our New Jersey state prisons, and those who were most vulnerable in our state. And that is unacceptable. And again, this is the first step down the right road in getting to the bottom and getting to the truth of what has happened here. Thank you.
Thank you, Senator. Assemblywoman?
May have signed off.
She's off? Okay. Well, again, let's chime off for the fourth time now. Listen, everybody, stay safe. Thank you very much. And just to echo what the senators have been saying, is this is not an event, it's a process. And what would help is personal, organizational phone calls to all the groups of the Senate, especially the majority party, saying, you know, you put up some cones on the George Washington Bridge, nobody died, it was the right thing to do, but within a nanosecond, you had a bicameral investigative committee with subpoena powers. The 8 or 9 or 10,000 souls, they deserve no less. Thank you very much.
Thank you.
Thank you.